have gone differently in hindsight. That's not really something that matters anymore at this point. Now you're like, why is the president saying IVSA made her sad? Shouldn't she say nice things about IVSA? I probably should. In a way, I am, because it's not the changes that we're proud of or the changes that make us happy, that shape us as individuals, that help us grow, that turn us into better versions of ourselves. More often than not, it's the changes that make us angry, the changes that hurt us, the changes that just force us to look at ourselves in the mirror and acknowledge that we're not perfect. It's those changes that actually have an impact on you. And it's those changes that just help you find out more about yourself. Those are the changes that you should be grateful for. And if anything, those are the changes that you should actually be proud of. I'm not here to give you a fairy tale story about how IVSA is always perfect and how it's always fun, because it's not, and it really shouldn't be. Very much like every single thing in life, IVSA can have its ups and downs. At least for me, it has had its ups and downs. And I mean, it's pretty obvious that when something's up, it can make you happy and it's nice. But what I've learned this year is that when something's down, that's still something to be happy about. So just to make sure that you don't get me wrong, I really do love IVSA with all of my heart, and I am incredibly grateful for every single thing that has happened this year. I am especially grateful for the bad moments, because no matter how cliche it is, and Kelly Clarkson knows, what doesn't kill you makes you stronger. So to conclude this little sad thing, I would like for all of you to carry that attitude with you in all of your future endeavors, be it IVSA, be it your education, be it your personal lives. Seeing the good in the bad is probably the most important thing I've learned this year, and I would like nothing more than for all of you to see that too. Sooner or later, someone may hold up a mirror to your face, and when you decide to close your eyes, you're going to be blind to a chance of personal growth. But if you decide to just open your eyes, you face your demons, face the dilemmas in all parts of your life, both personal and professional. That's like when, where, and how you learn. So I'm going to go ahead and check out the chat in a minute when I'm done with my speech. But I've seen lots and lots of messages come in, so thank you guys so much for actually participating. Do take your time to read some of the others' comments as well. Let them inspire you, let their accomplishments, their cheerful moments, but most importantly, let their challenges inspire you as well. Then I would like all of you to hopefully think about me again in a year or so, and do this again. Write down these 3 changes. Take a moment to reflect upon them, because it's going to allow for you to, learn more about yourself, also learn more about the others around you. Now, talking about inspiration, sometimes it really is the smallest things in life that make your mind wander. And that's what happened when I saw the title of the WGA's workshop tomorrow, which is From Vet Student to Vet. And let's be honest, that's why we're all here in the end. And that's going to be the biggest change in our nearby futures. We all aspire to become veterinarians one day. Different fields of veterinary medicine from all over the world. However, the journey we're all taking is very similar, to say the least. We all have different desires and needs. As long as we don't discover what we want from ourselves, what we stand for, what we live for, we're going to live unfulfilled lives. Sometimes it's just time to go back to the basics and start with why. Why do you want to become a veterinarian? Why do you want to become an IVSA official if you're running? Why do you want to achieve your goals in life? From that why, you move on, because you can do so many things, but once you start to realize why you're doing it and you're using that as the source of your inspiration, then it's going to be 10 times more successful, and it's going to be so much easier to inspire others around you to join forces and take action as well. With each decision that we make, we tell ourselves, but we also tell the world around us who we are. All of you are going to graduate vet school one day, I hope. And then having the job of your dreams, having like such an enviable career is one thing, but being a happy person is another. So creating a life that just reflects your values and satisfies your soul is a very rare achievement. We live in a world that relentlessly promotes unattainable ideals, and many things that diverge from the norm is considered bad. You're going to be told in 100 ways, some subtle, some less subtle, to keep climbing, to never be satisfied with where you are, who you are, and what you're doing. But nothing's further from the truth. To invent your own life's meaning definitely isn't easy, but it's allowed. And I really do believe that you're going to be so much happier when doing exactly that. I hope that you'll find that IVSA has touched a deep part of you. Maybe you've only just joined, but for some of you that have been here for a while now, it is fair to say that all those years with IVSA have been formative years. I'm sure that somewhere along the line, someone or something within IVSA has transmitted a spark of insight or interest that you've never had before. So cultivate that interest, and then hopefully you can find a deeper meaning in your life that can feed your soul and your spirit. Your preparation for the real world in the end is not the answers that you've learned, but it's the questions that you've learned to ask yourself. And having been a member of IVSA, I suspect you're going to find yourselves quite well prepared for the real world. That's also what I would like for you to use this event for. Let go of any and all expectations you had previously. Simply come at it with a fully open mind. Let the lecturers surprise you. Let them light that flame of passion inside of you. Let yourself be like fully immersed into new experiences, because even the smallest thing might cascade into the biggest change of your life. And I hope by now you've realized that change actually is a beautiful thing. I also want to take this opportunity to thank every single person involved in shaping this event into its final form, every single member of the online organizing committee, the online attendance committee, and especially the organizing committee from IVSA, the Netherlands as well. All of you have truly done such an amazing job, and you really do embody what IVSA is all about. IVSA allows for change, allows a space where people can learn new things about themselves, where they can face that mirror, look themselves in the eyes, and properly reflect. And this event, in my opinion, is an incredible opportunity for that once more. IVSA symbolizes personal growth as much as every single person individual for this event symbolizes that exact same thing. And therefore, I want to just kind of use this moment to thank every single person in the organizing committee. So Goddess, thank you, whose second time it was actually on the OOC. So a double thanks. Then also Ahmed, Barbara, Atem, Isabel, John, Julia, Kushi, Larissa, Nidhi, Sandra, and Tessa. Thank you guys so much. You've been amazing. And thank you, Daniel, as well, for running the online attendance committee and doing all the tech stuff I never will be able to do in my entire life ever. Without all of you, this event would not have been possible. You spend hours on end just so we can all learn, so the delegates can meet new people, so we can find that spark of interest, so that we can change a bit. And the way that you've handled the time pressure of organizing such a last-minute event is absolutely mind-blowing. Not in a million years would I have expected such an amazing result on such short notice, but you pulled it off anyways, and you've inspired me so much, and I truly hope I'll get to enjoy much more of your amazing work in IVSA or other organizations in the future as well. And then to my dearest executive committee, and all other IVSA officials, it has been a shitty year. I'm not going to make it any better than it is because it has sucked donkey balls. Do not excuse my language. However, you're still here. You've overcome every single obstacle. You've grown. We've all grown together as a team. We've suffered some harsh blows. We've had to tackle some really hard topics. had to counter more issues than any other team of officials has ever had to do before. But in the end, you know, we made it through. We've kept going. I think that is such an incredibly admirable thing. I am so proud of you all as individuals. I'm even prouder of all of us as a team. If anything, this year it has taught us our strengths, but it's also taught us our weaknesses. Though some of you may will continue to be on the team of IVSA officials next year as well. Others I'm going to separate ways with already, which saddens me a lot. Please know that I wish each and every single one of you nothing but joy, success, and plenty of challenges. You've proven yourself to be wonderful people, and I cannot wait to see what you're going to accomplish next. Take your passion, your motivation, and just use it to better our worldwide veterinary community. Though we may walk different paths from here on out, I am sure that those paths are going to cross again in the near, maybe even in the far futures. And then that'll be an opportunity for us to catch up again, look back and talk about the good and the bad all days. It has been an honor to be your president, but even more so to be your friend. I love you all so much. Thank you for listening, for speaking your minds, sharing your stories, and I hope you all enjoy the amazing workshops and lectures we planned for you. I have finished just a little bit earlier, so there's plenty of time left for the OOC to start with the introduction to the Icebreaker. Have fun, everyone, and I really hope I'll get to meet many of you soon, both online now, as well as hopefully in person someday in the future. And that was it for me. I'm gonna just go ahead and mute myself and hand over to the OOC and read all of your chat messages. Thanks for listening, guys. Mwah.
Hello, can everyone hear me? Okay, so before we start, I would like to everyone to quickly introduce themselves and tell us your age, your MO, and your veterinary school, and something like your favorite food. And if it's a traditional dish from your country, please explain what it is, because I'm very curious about any food, okay? So I will start. My name is Larissa. I'm from São Paulo, Brazil, and I'm in the first year of my vet school. It's University of São Paulo, and my favorite food, I guess, it's sushi. It's not the Brazilian dish, but sushi is definitely my favorite dish. So, who's going next? Okay.
Larissa, I think we're gonna put people out in breakout rooms so they can actually unmute themselves and talk in smaller groups. I think that was the. So now you have an idea of what to say when you're out in the breakout rooms, and we'll call you back soon.
Okay. All right?
Microsoft Teams is working, so bear with us. It's not always the quickest worker.
We have 2 links for the Icebreaker room, so please check your emails. Then you see what breakout room you are, and then we can start with smaller groups. Okay, that was my alarm. I'm sorry.
All right, so I will start the breakout rooms now, and you will get automatically assigned to a breakout room in a second. And we will close them and call you all back when it's time to do another session of something else. And it's opening, but it's 20 rooms, so it's thinking a lot. Kind of like vet students going to an exam, right? Takes a lot of effort. You might be tired afterwards, but I hope Microsoft Teams doesn't get tired, because we need this bad boy all day.
Yes, I hope so too. If you got another email with a new link to an icebreaker, that means you're in the second group, and then you can just go ahead and join that meeting. Not everyone got it. It's just only for half of the delegates are going to be in the second icebreaker room, and the other half can just stay in here. So do check your emails to make sure you're in the correct room. We've split them up just because that way it's going to be easier for Microsoft Teams to handle all of the different breakout rooms.
Microsoft Teams is thinking. In the meantime, please look at each other's beautiful faces, because you'll need your camera for the next session. So you can just turn it on now. It's needed. It's much more fun to look at people than to look at a dumb icon that says KT or TJ.
In the meantime, I also want to let you know that I'm reading all of your chats, and I really appreciate all of you sharing all of your proud, happy, and sad moments. It makes me happy and sad at the same time to read, but I'm proud of all of you, so thank you. Just another quick reminder that if you got another link through your emails for the icebreaker, you can leave this meeting and join that one, just to make sure that we have all of the people spread out evenly. That is because Microsoft Teams finds it hard to put like lots of people in different breakout rooms, which is why we've tried to spread it over 2 different meetings. If you didn't get a link, that's fine, don't worry. If you got a link, that means you're in the second half, which means you're in the second meeting. So then please leave this one and go to the other one.
So the breakout rooms are starting to open now. I just had to open every one of them manually instead of opening all at the same time. So hope some of you have been put in there already. And yeah, remember to introduce yourself and talk with people from new countries. It's always a pleasure. I may have said that too soon, but I mean, 2 people are in breakout rooms, so that's a good start.
so I'm not sure everybody has already been able to open their email.
Okay, I'll just share the first slide in the meantime. Is that okay?
Yes, that's great. Okay, so while we're waiting for the last few people, thank you all for being here. I'm really excited about this lecture because we're going to hear from Leonie about radiology and also a bit forensic radiology. Leonie van Bruggen is I'm not that great in speaking out all the letters, ECVDI accredited specialist in veterinary diagnostics from the Netherlands. And she's going to tell you all about radiology. Don't know about it that much, so I won't try and explain it. If you have any questions during this lecture, please write it down in the chat or raise your digital hand. At the moment, you're not able to unmute yourselves, but if you raise your hand, me or one of the other people from the OAC will allow you to unmute yourselves, and then you can unmute yourselves and ask your question. Leonie would like it if you just ask it whenever a question pops up. And yeah, that's it. So I'll give the floor to Leonie to start this incredible lecture. I'm really looking forward to it. I hope you do so as well, and enjoy.
All right, I think I unmuted myself now. Just to double check, are you seeing my presentation right now?
Yes, I see your presentation. It's still in the overview of PowerPoint.
And now I hope it's not.
Yes.
Yes, first slide, right? Okay, excellent. So hello, everyone. My name is Leonie, and I am a radiologist at Utrecht University. And I studied veterinary medicine in Utrecht. And then I went to work abroad for a while in England and the United States. I, as a vet student, visited India and Nepal and looked around a little bit over there. And I like the whole traveling as a veterinarian idea. And I think it's wonderful that I can speak to so many veterinary students via this internet connection. So what I did, I made kind of a mashup of a couple of presentations that I have, and we'll see how it goes. Let me know if you don't understand things that I'm saying. You can do it either via the chat, or you can, I don't think you can unmute yourself, so just raise your hand. And people who keep an eye, there are some people who keep an eye on the chat, and they will make me aware of the fact that there's a question. Okay. So what I like about veterinary medicine is that we work with animals, and animals play a more and more important role in family life. And they're not the same as people. They're a bit different, but they are important. And sometimes the health of the animal also says something about the health of the owner. Maybe some of you have seen animals that are very obese in the clinics, and maybe sometimes the owners are also quite large. Sometimes we have animals that have the same diseases as their pets. Like if you, in the future, will have a conversation with an owner about their pet having cancer, you will get into the situation where the owner will tell you that they themselves are suffering from that disease also. So there's a lot of, you're not just treating the pet, you're also having to deal with the owner, maybe even more so than dealing with the pet. So what I'll talk to you about today is about veterinary medicine, and this is my program. I'm going to talk a little bit about the background of radiology. I understood there are veterinary students listening in from year 0 or 1 till the end of their graduation. I'll talk a little bit about radiation and working with radiation. Of course, I'll talk about the interpretation. Hopefully, you'll learn some interpretation along the way. And I will also talk about forensic radiology and imaging, a topic that I'm currently doing research in, and I think is very interesting. because of multiple reasons. So I have a job because of this gentleman, Mr. Wilhelm Röntgen, and one day he took a picture of his wife, of the hand of his wife. This is the first radiograph that we know. It's the hand of Anne-Bertha, and you can see that we've come a long way. She's wearing the wedding ring, and interestingly enough, when they took this radiograph, quite quickly actually after being aware of that we can produce X-rays, people thought that those rays were magical rays. So what they did, besides taking radiographs, they also, and I found that very interesting, they also used that radiation to produce a polish that you could clean your stove with. Or they would radiate pills and would think those magical rays would help you alleviate like headaches and stuff. So they thought that would work. Of course it didn't, but they thought it did. So first X-ray. We've come a long way. Nowadays, this is more the quality of the radiographs that we take. And of course, this is a human hand. For us, that's maybe less interesting. This is the hand of a dog. And it's interesting because looking forward a little bit to my presentation later on, let's say, excuse me, this is the hand of his wife, and the hand on the left is the hand of his dog. Or maybe this is the hand of the dog. And I hope you can see my arrow. Let me know if you don't, because then I'll be more descriptive about what I'm talking about. But if you look on the left side, so both of these are forepaws of dogs, right? You can see the toes, you can see the carpal bones, and you can see the radius and the ulna. They're different dogs. This is a young dog. You can still see that the growth plates are open. It's a growing dog. There are also some growth plates here that are also still open. But this dog has a fracture here in 2 metacarpal bones. They're not very new fractures, they're quite old. And we know that because we can see new bone formation here, trying to bridge that gap. And here in this metacarpal bone, in the 4th metacarpal bone, it's already a little bit further healed than in the 3rd metacarpal bone. It's still a little bit open. So maybe Mr. Röntgen stepped on the foot of his dog, or did he do that on purpose or not? And I hope that from this talk that I have this afternoon, I hope that you learn a little better interpretation, a little bit maybe more than you already know, but some of you know. But I also hope that the next time you see a fracture on a radiograph, you'll think of this talk and you'll think, okay, so the owner says this is a traumatic fracture, but is it really? Does it fit with what I see on the radiograph? So radiation, just I can't talk to veterinary students about radiography and interpretation without talking a little bit about very important stuff, because we're dealing with radiation. And I know that a lot of you probably already heard about this stuff. What is radiation? It's the transfer of energy through a space or a medium. It can be through tissue, in case of ultrasound, for example, or through air when you take a radiograph, in a form of waves or particles. So if it's wave, for example, X-rays or sound waves. So in veterinary radiology, we're dealing with radiation. There are very many different types of electromagnetic radiation, and they vary on their energy level because of the length of their wave. So if the wavelength becomes shorter, the energy of the radiation, the transmitted radiation, becomes higher. And if the wavelength becomes longer, the energy of the radiation becomes lower. So why is that important? Well, in the days, back into history again, this early 1900s, where they know nothing about X-rays and their negative effects. they used actually the X-rays. They would put an X-ray tube in this box, and the gentleman over here would push on a pedal, and X-rays would be transmitted through your toes. There will be a hole here where this child is standing or this lady is standing. There'll be a hole. You can fit your feet in there, and you could see over here, like this lady does and this gentleman, they look live at her toes. So that's not good for your eyes. And over here on the right bottom side, you could see other magical things that those magical rays could do. They would think that it could alleviate women with hair on their faces. If you would have some X-rays at your face, then those hair would disappear. And they would, but not in a friendly way. So now that we've learned so much more about the negative effects of radiation and using radiation, we know what not to do when we use those X-rays to our benefit. So these are the hands of technicians who worked a lot with X-rays. So you can see if you stick your hands in the primary beam a lot, that's what happened to these people. It can cause dermatitis and even eventually cause that you have to amputate some of your fingers. And this is the face of the woman who put her face in front of that thing to remove any facial hair. So it's not good. So if I look back at that image that I just showed you, look at the wavelength. The shorter it gets, the higher the energy it gets, I just told you. And at one point, the radiation becomes ionizing radiation. And that's where we work. So we work in the field of the ionizing radiation. Of course, in a microwave or your cell phone or visible light, that's not ionizing. Visible light also includes UV light, or it becomes less visible. But at one point, UV light also becomes damaging. So UV light is kind of the cutoff point where radiation becomes, electromagnetic radiation becomes harmful. So what do we need when we work with radiographs or with X-rays in private practice? We need protection, and a lot of protection. Of course, these glasses won't protect you for the damaging consequences of radiation, but there are glasses you can use in private practice that do have, this is LED glass, so you can look through them, but they won't let through X-rays or scatter radiation. I'll talk a little bit about that in a couple of slides after this one. So we need protection. And I tell you this because once you've graduated, you will be responsible for the people who work in your practice and who will work with radiation because you tell them so, tell them to. If you're lucky, you will work in a private practice with a team of technicians who will help you take those radiographs, or ideally will take those radiographs for you. And I say ideally because if people practice more with taking radiographs, they become quicker, they will learn how to take a good radiograph, and they will do it quicker, which is nicer, less stress for the animal, and it will give you better radiographs. If I am on call out of hours and I have to take radiographs, it's actually, I don't produce the best quality of radiographs. My co-workers, the technicians are much better because they do it all day long. They're much better at it. So I kind of produce okay radiographs out of hours. So I hope that you get to work with a wonderful team later on that will help you get those good radiographs. So we need protection. Excuse me. And what you see here, this gentleman is wearing those goggles. It's actually the goggles that we don't often use in private practice, but for example, doctors who do cardiac procedures, they stand in a fluoroscopic room, so they stand in scatter radiation a lot of the time, and they do wear those goggles. Protection is important for scatter radiation. I certainly want to tell you the difference between the primary beam and scatter radiation. I'm sure most of you have heard about it. The primary beam originates from the X-ray tube. The X-ray tube, there's a hole in the lead shield around the whole X-ray tube, and the hole is here at the bottom. So that's the place where the X-rays get out if you push the button. And the primary beam will go through the animal, through the table, onto this detector, and that will give you the image that you see on the right side. So that's the primary beam. You are never to have your hand or anyone else's hand have that in the primary beam. In the Netherlands, where I work, I still see the occasional radiograph sent in from private practice where this went wrong. Either because the animal suddenly moved while someone was just pushing the button, or they didn't pay attention in class. But the primary beam is not for you to stick your fingers in, or the fingers of your coworkers, or the fingers of the owners. Okay, so no hands in the primary beam. Also no gloved hands. Once the primary beam hits the animal, scatter radiation starts to radiate in all directions. So the primary beam goes from the X-ray tube to the patient. The scatter radiation starts in the patient and goes in all directions. And this is the reason, this is what we dress ourselves up for. This is what we wear the aprons for. This is what we wear, but we put the lead flaps and the lead glass in between the patient and our faces and our bodies for. This is why we wear the gloves. So it's not for the primary beam, it's really for the scatter radiation. So similar, this is the X-ray tube. Primary beam goes through the patient. There's no hand in the primary beam. You see, this is the radiograph of the chest. She keeps her arm on the neck to keep the dog on the table. And so the primary beam goes through the dog. We get a picture. We do it digitally. It doesn't matter whether you're working digitally or still with analog material. It doesn't matter, because all this trajectory is exactly the same, even in digital and in analog methods of working. So no hands in the primary beam. The scatter radiation starts and beams in all directions as long as someone is pushing the button. So, and that's what we're dressing ourselves up for, okay? We get this radiograph. So important to talk a little bit about the interpretation. We look at the thorax. We like to compare the right half of the thorax with the left half of the thorax. So we like the spinous processes to be in the center. It makes our job much more easier if we can compare the right and the left. When displaying the radiograph, you can see, let me put it different. If we take this radiograph, the right side of the patient will be on the right side of the image, and the left side will be on the left side of the image. If you look up radiographs in books and stuff, they always print them as if you were to do surgery on the patient. So they will print the left side of the dog on the right side of the picture, and vice versa, the left side of the dog on the right side of the picture. How can you tell the difference? A lot of times, not always, a lot of times the apex of the heart points towards the right. Not always. The aortic arch, of course, is on the left side. You see that line here, it's the aortic arch. The caudal vena cava is on the right side. This is the caudal vena cava. And in the abdomen, in a dog in ventral recumbency, the air in the stomach will go up to the most dorsally located part of the stomach, and that is the fundic region. And as you know, anatomy, the fundic region of the dog is in the left side of the dog. So here you see some air in the fundic region. So you know this is the left side of the dog. If you have a team working with you, taking all those radiographs, sometimes they will, we don't, in Utrecht, we don't put L's and R's next to our patients to determine left or right, because we feel you should be able to see that on the radiograph in the way I just told you. But in a lot of places, they do have that tradition. But sometimes, you know, you're in a hurry and there's a lot of stress and we need those radiographs right now and quickly. And sometimes they'll mistakenly put the R on the left side and maybe the L on the right side. So for you as a veterinarian, you need to be able to tell the difference between the left side and the right side on a thoracic picture, and also of an abdominal picture. Okay, so this is how you do it. You can look at the aortic arch. You can look at the cauda vena cava on the right side. Aortic arch, it should be on the left side. And the fundus. Those things will help you to determine left or right. Similarly, if we take a radiograph, dog and lateral recumbency of the chest, primary beam, no hands in the primary beam. We dress ourselves for the scatter to protect ourselves for the scatter radiation. We get a lateral view. So this is the animal. The radiographs, the rays go through the animal, and this is what we see. This is what we see on the computer. Actually, it's not yet what we see on this computer, but they're waiting for the result. This is the previous picture that you see over there. This is the picture that they get. But in a book, you will see that all lateral views of the thorax and of the abdomen are all printed with the head towards the left. So that is what I advise you to do if you start learning how to interpret radiographs, because you may want to look things up in books, and then it's much easier for you to learn this image than learn two different images, because for your brain, this image, this lateral view of the thorax, is a totally different image than this image. If you want to learn radiology, if you want to learn how to interpret radiographs, always look at the radiographs, especially of chest and abdomen, in the same manner. So head towards the left, and as if you were to do surgery on the dog. So the left side of the dog on the right, and the right side of the dog on the left. Okay, it helps you to develop a what is normal image quicker than if you were to do it in a different way. Okay, so you flip image and then you start interpreting the radiograph. A little bit more about the radiation. So this is the X-ray tube. Primary beam goes through the patient onto the radiograph, and this is the radiograph that you get. When the X-rays go through the patient, scatter radiation starts and will go in all sorts of different directions. So this is the scatter radiation, right? We're hovering over the patient as if we are the X-ray tube. You can see that that person there is keeping up a lead shield. So that person is not catching any scatter radiation. Now, knowing this, if you, I already talked to this. So knowing this, sometimes in private practice, I see these type of lead gloves, right? And sometimes I see this happening. I sometimes also give post-academic teaching to veterinary technicians, and I talk to them about what is custom in their private practice, and I hear this basically, and I'm sure this happens all over the world, really. You take a radiograph. This is an old pictures where we still used to do myelograms, but it's similar from doing, for example, a barium study or doing a contrast study from the bladder, where you're working near a part of the body and your hand needs to be close by for whatever reason, and someone, a helper, thinks he's helping you by putting on a lead glove and hiding or shielding your hands from radiation. It's not doing anything because the radiation is not coming from the primary beam, because, like I said, the primary beam is focused on the patient. It's the scatter radiation that we want to shield ourselves for, and that is, there's nothing in between the scatter radiation originating, in this case, from the neck, or in another case from the abdomen, and the hands of the person standing next to it, right? So these may look handy, but they're not, because your fingers still stick out, so they will still reach scatter radiation. To point out to you what those lead gloves do, because sometimes we get a radiograph and you can see part of the lead glove on the picture, and people say, "Oh, but I was wearing a lead glove, so I'm not bothered by the radiation." But if you take off half of that lead glove, and then take a picture. You can actually see the contour of your hand. So your hand in the glove is not shielded enough by, what is it, 4 or 5 millimeters of lead surrounding the hand. It's not working. Okay. So we wear protective clothing, we wear an apron, we wear gloves if we're touching the patient, or if we're near the patient, we're wearing sometimes for your thyroid protector, because thyroid tissue is sensitive to that. And also, we don't take a radiograph of parts of the body that we don't need to see on the radiograph. So this animal, for example, comes in for respiratory distress. It's a very old picture. It's taken in private practice. And if you look at this picture, and I'll give you a little bit time to look at it yourself and see what's going on, not necessarily inside the animal, but the way that the animal is held on the table when the radiograph is taken. His head is over here, looks a bit funky. His vertebral column, this is his chest, this is his abdomen. His abdomen is filled with air because of the respiratory distress. He's swallowing a lot of air. But someone is holding the head of the animal, the puppy, I think, with bare hands. And the other hand, so these are fingers holding the front legs. We don't need to see those on a radiograph, and this is not the way you want to take a radiograph. This is what we want to see in a radiograph. The puppy is in respiratory distress. Someone is holding the animal, and you want to have the chest on the radiograph. So likewise, this is another patient. Same problem. Someone is holding the animal. And you're a veterinarian saying, oh, you know, the thing is, they weren't my hands. They were the owner's hands. Or doesn't matter. You are responsible as a veterinarian, and you can actually get yourself into big problems if they catch you doing this. I learned from talking to veterinary assistants all over the world that this still sometimes happens in private practice. And I think you, as young new colleagues, should be aware of that, and we should do better. Okay. So we don't want to have the whole animal on the radiograph. We just want this. Okay. So collimate and also distance. So if you are going to take a radiograph of a pet, you're not going to be on top of the pet, holding down the pet, but you want to stretch your arms. Stretch your arms. Wear the gloves, of course, but stretch your arms, because distance is important. If this is the X-ray tube here on the top, and X-rays come out, this is the primary beam. Sorry, my hand is not very steady in the morning. This is the patient. This is where the light bulb, it represents the origin of the scatter radiation. This is the patient. So the scatter radiation also goes in this direction. And what if you were to stand over here? You will catch more scatter radiation if you're standing here compared to when you're standing here, or compared to when you're standing here. Okay. So it makes a difference. And the inverse square law, you can calculate and everything, but I think it's important to know that taking a step back does a lot more for catching scatter radiation than just halving it. Because if you double your distance, it's actually 2 squared inverse. Sorry, I can't do math in English, and you can't do Dutch. So, but I think this picture says everything. Okay, so stretch your hands, be on the short sides of the table, because that forces your body already to have a distance to the patient, and with that, the origin of the scatter radiation. Right, this is the last picture about this topic. So if it is the origin of your scatter radiation, you can imagine if you're standing here in the inner circle, you're closest to the origin of scatter, you will catch a lot more than if you're standing away from the patient. So like here, my colleagues here are holding the animal, they're standing on the short sides of the table. Primary beam goes through the patient because we want to take a radiograph of this dog that is coughing for some time. There's no hand in the primary beam. We do not wear lead gloves, so we can get into the primary beam. We wear the lead gloves for the scatter radiation. We take distance, we dress ourselves up for the scatter radiation, And this person does not necessarily have to be next to the patient. She can actually go outside of the room even. In the Netherlands, typically we stand inside the room when we take the radiographs. I know there are also countries, for example, when I worked in England, no one was standing in the room, no one was allowed. There's different legislation. I'm sure that in different countries in the world, they have different methods. I've often also spoken to people where they were not accustomed to wearing lead aprons. So we can all improve, and I hope this has helped you a little bit with that. So here in the equine, I'm a small animal radiologist mainly. I sometimes do horses, but just to show you what we can do when we take a radiograph of a horse, you can either hold that cassette when you were trying to take a radiograph of the stifle with your hand. Ideally, you have something that you can put the cassette in, so it's much easier for Suzanne here, my colleague, to take a distance to that origin of the scatter radiation. Okay, now interpretation, that's what we're here to learn also. What do you need to know for interpretation? Anatomy. I think anatomy is the most important thing. I think it's about 80% of what I do during my daily work in the clinic is checking whether what I see on the radiograph matches with what I know should be there from my knowledge of anatomy. And I'm not kidding. I think it's really important. You need to know lines of the scapula, of the bony structures have so many places where ligaments attach, where blood vessels run through. If you see more radiographs in your professional career, you will start appreciating more and more that you'll get better at recognizing normal anatomy. On a standard stifle radiograph, you can very nicely see the various muscles run through the various places around the stifle and where they attach to the bone. So it's actually very pretty. The more fat an animal has, the better actually for the radiograph, because it gives a lot of detail to an image. Anatomy. Know your anatomy. If a student comes into my interpretation room, and depending a little bit on where they are in their studies, I do sometimes refer them back to the books, because you need to know your anatomy. Also, of course, is know a routine. That if out there in private practice and you start interpreting radiographs, it really helps if you know, okay, I have a dog in respiratory distress on my table, and I need to interpret this radiograph of the thorax, and I'm not really good at it. Oh, what do I need to do? It's always very nice if you have a routine to fall back on. So I'm not going to teach you the routine here, because you can find them in textbooks. I think I have 1 or 2 slides showing you what routine I usually use. I'm not saying that that's the routine that you should use, but a routine helps you that you can wake up in the middle of the night, being maybe on call. You take a radiograph, and it helps you to not oversee anything, not to forget any part of the body to look at. I'll have some examples later on of things on the corner of the image that you'll oversee if you don't have a routine that you use when interpreting radiographs. So it's very important. And the anatomy. So most of you may know who this is. And if you don't, I'm sure that you'll see that this lady is the same lady in 9 different or even 10 different versions. The color of her face changes, the color of her eyes, the color of the background, the color of her, everything changes, but you see it's the same person. And why do you see that? Because you have a blueprint. So this is a picture of Marilyn Monroe, but this could also be a picture of someone that you're very used to. For example, your partner, your mother, your father, your next door neighbor, your best friend, or your worst enemy. someone you know very well, you have a blueprint of that face in your head. And if you see that person with a different glasses, or that person went to hairdressers, has different hair, you'll still recognize that person because you have a blueprint. And you have that blueprint because you saw that person's face over and over and over again. And that is the way that we learn how to interpret radiographs, because you need to have a normal. You need to have a normal of what a person looks like. So you know this is James Bond. You know this is James Bond. They look totally different, but you know it's James Bond because they have similar appearances. You know all these men are James Bond. They all look different, but you know it's James Bond. And this will be James Bond. So even in the future, sometimes things may change. Your mother may change glasses, but you will still know it is James Bond because that person fits to certain identifiers. Okay. Even if they change very much, you still know it's James Bond. It's the same with chest radio. It's the same with radiography in general. It's the same with chest radiography. So you know, and because I tell you too, this is a normal chest radiograph, right? So we see extrathoracic structures. We see 2 front legs, scapula, a little bit superimposed here on the cranial aspect of the thorax, front leg, vertebral column, cardiac silhouette, mediastinum with the trachea diverging here into 2 main stem bronchi. You can even see the right main stem bronchi also diverging in multiple other bronchi. Same for the left side, even here diverging. Caudal vena cava should be here somewhere. Can't see it very clearly. I know this is the right side of the animal because the caudal vena cava is over here. The apex of the heart points, in this case, towards the left. I know it's the left because the aortic arch is here on the left. I know it's the left because the fundic region is on the left. Sometimes even if the radiograph is not collimated
Leonie,
enough.
I'm just breaking in quickly.
Yeah.
I noticed some people have a bit of a slow connection, so the image of what you are doing doesn't fit what you're saying. So
Okay.
I think it would be useful if you are a little bit more descriptive about what you're pointing to, because some will see what you're pointing to, but some will see it 5 seconds later.
Okay. Good, thanks. All right. So this is a chest radiograph. So this is where I hope you can see the stomach here, or where the most air is here in the stomach. And I know that's the fundic region because it's a dorsal ventral radiograph. We typically take a dorsal ventral radiograph, so the dog in ventral recumbency. So I can tell left from right. So knowing normal, looking at this image, just not doing well. He may be in respiratory distress, or he may not be keeping weight. He may be losing weight, and you can't hear normal lung sounds. You think you hear something abnormal. For whatever reason, you choose to do a radiograph of the chest. If you don't know where to start in this image, just start with your normal structures, the things that you can see. So you can see there's not a lot of fat outside of the outside of the chest. I'm sorry. You can see it, right? So we compare it to the normal picture, which I put on the left. But you in your private practice, you can have that in a book, or you can look back in your archives and determine, maybe build a folder with normal radiographs if you work with analog material still.
There's a question. If it's okay if I unmute the person that you can ask the question?
Sure, okay. Go ahead. Hello?
Yeah, sorry, I'm waiting because it should be.
Okay.
So about the book, can you unmute yourself? No. I'll just make you presenter and now you can. You should be able to unmute yourself. Saibabatul? I'm not sure how to pronounce your name. Otherwise, please just write your question in the chat if you did this by accident. Leonie, I think you can continue.
Okay, thank you. So it's always easier at least, to compare normal to abnormal. So it's nice to have a stack of normal thoraxes, normal abdomens, normal abdomen for a cat, normal abdomen for a dog. Have that somewhere where you can reach it when you're doing your clinical work, either in a book or on a digital device, or because you can look back and you have a set of number of normal patients, or you have them in a folder stacked in a closet, doesn't matter. It's nice if you learning how to interpret radiographs and you did not yet develop a blueprint of what is normal in your head, and so you can compare. So for comparison purposes, I put a normal radiograph here on the left. So on the right, I do not see the cardiac silhouette as well anymore. So that means that the lungs surrounding the cardiac silhouette are not as air containing as much as they should be. I cannot see the diaphragm or the contour of the diaphragm as well as in a normal picture. So that means that the air in the lungs there's not as much air in the lungs as 1 second, sorry, I'm a little bit distracted by myself. Mike. Ja, je maakt te veel gedaan. Kan je wat zachter doen als je doet? Sorry. It's weekend, we're all at home. So there's not you can see the contour of a soft tissue structure like the diaphragm with the liver, because there's air in the lung, giving that difference in attenuation. Lung attenuates less of X-rays than soft tissue does. So if I look at the lung tissue, I would like to see, as I can see on the left side, I would like to see soft tissue structures, linear structures, running towards the periphery. I can't see that anymore or appreciate that anymore in the radiograph on the right side. I can see all sorts of nodules, cannonball type structures all throughout the lungs. So I'm sure most of you already recognized that this is a cannonball presentation of metastatic disease, most likely. So it's easy if you can compare it to another normal radiograph. And sometimes the animal itself also provides room for comparison, because the picture on the right, you can see the contour of the cardiac silhouette in the left side of the animal. So that is on the right side of the picture. It's where my arrow is right now. You can see the contour of the heart, and you can see that because there's aerated tissue, lung tissue, right next to it. And the aerated lung tissue follows the outer contour of the thorax. I can see small linear vessels run all the way to the periphery. I see a nice contour there of the diaphragm and the liver. If I go to the right hemithorax of this animal, I cannot follow the contour of the cardiac silhouette as well. And that is because there's this opaque structure right next to it. It apparently attenuates as much radio X-rays as the cardiac silhouette does. And outside that structure, I do not see linear vasculature anymore. So what happened here is that this animal has a collapsed lung, and there's air in the pleural space. So it's a pneumothorax. Different patient, the same strategy. I compare it to the normal picture. I can see the spinous processes in the middle. I see a very wide mediastinum, very wide. If you compare it to a normal dog, it's much more narrow. It's about 1.5 times the width here of the vertebral column. I see the trachea there sticking out a little bit. But if I go to our patient there, it's much, much, much wider. And also, if I look at the extrathoracic structures, there is a lot of soft tissue and a lot of fat tissue there. This is a very obese animal. Okay, so it's nice to compare to normal. Lateral views. On the left, we have our normal patient. Usually what I do, if I look at the chest radiograph, I interpret outward in, because normally we take the radiograph of the chest because something of our concern is inside the thorax. Either there's a cardiovascular pathology suspected, or there's a lung pathology suspected. So we're basically making the radiograph for something that's going on in the chest. So in order to not forget to look at the rest of the radiograph, I look at that first, and then I concentrate on the stuff on the inside. So I look at the soft tissues outside, I look at the spinous processes, I look at the bony structures, all still outside the scapula, here all still outside the chest. I look at the thoracic inlet. I see the trachea there running in the caudal neck region, sternum, soft tissues, ventral to the sternum. I look at the abdomen. I expect to see the stomach there in the abdomen, especially in dogs. Cats don't swallow that much air usually, but dogs do. I see here mineralization of the rib cartilages. That is very variable. It's almost as variable as a fingerprint. One of my professors used to say that the mineralization, the status of the mineralization of the rib cartilages can serve as a fingerprint in animals. So that is how much variation there can be in those. So in the lateral view, there are also some things we usually can see inside the chest. The trachea, we can see the aortic arch, we can see the caudal vena cava. They're running between the cardiac silhouette and the liver. We can see the cardiac silhouette itself, of course, which consists of the heart and the pericardium. And there may be fluid in there sometimes. In very few occasions, there may even be air in there at some cases, but that's very rare. But there may be fluid, and those cases you will see in private practice. And then we see the lung tissue. It's well, it's well filled with air. It follows the contours of the chest. I can see all these linear vascular structures running towards the periphery, which is really nice, to the ventral periphery, to the cranial ventral periphery. They outline the bronchial aerated bronchi. And then on the right, a patient that had a very narrow trachea. And it stands out because the air-filled trachea is usually the only air-filled structure you'll see in the cranial mediastinum and cranial to the thoracic inlet in the caudal neck region. And it's very nice to see the difference between the two radiographs. It makes it easier to recognize pathology. Here, so if you look at the trachea on these two radiographs, it's very obvious where the trachea is, right? You can see it. It runs it stands out because it's surrounded by the soft tissue structures, other soft tissue structures that you cannot recognize individually in the cranial mediastinum or in the caudal neck. But if air is not only in the trachea, but also surrounding the trachea, it's much more difficult to recognize the trachea. And you may even start seeing, here on the right picture, the other larger vessels that come off the aortic arch there and run there in the cranial mediastinum. You may even see the cranial vena cava. You may even see the esophagus running there. And you kind of lose the nice contrast here you have in the caudal neck region where you just see the aerated trachea. You don't really see that anymore here in the patient on the right, because there's not only air in the trachea, there's only air in the tissues around it. So he has a pneumomediastinum, maybe because of a wound he had to the neck, can be different reasons. If you look at an image, it's good to know that you don't always look at the whole image. You just look at certain areas. Here on the top, you see two pictures, a photograph and drawing. And on the bottom, you see what people looked at. And they managed to get those images by eye tracking devices. So they can see exactly what the people look at. So you see that no one looked here at the left bottom area of that picture of the girl. But if this were a chest radiograph, that might just be where the nodule is, or that might just be where the osteolytic lesion in one of the ribs might be. So you need to force yourself to look at the whole image. And more often than seldom, there are key findings to be seen in the periphery of radiographs. So if you make a radiograph, if you go through the effort and you expose your patient and maybe your coworkers to radiation, look at the whole radiograph. Interpretation is easy. There are only 5 colors on a radiograph to be identified. And all there's to it is to determine what kind of opacity you're looking at, and if that is the normal opacity of that structure in that position. That's all. It's really easy. It takes a bit of practice, but that's really what it comes down to. So we got 5 opacities. The darkest is air outside the leg, for example. Here, this is a radiograph of a stifle. You can see here the upper leg, the femur with the kneecap, the patella. You see here the lower leg, the tibia with the fibula. And you see all the muscles. You can even see this musculature, now that you know that anatomy is really important. You can even see this one go all the way up to this little bump here at the caudal aspect of the femur, which is normal because that is the place where this muscle runs to and attaches. So what we're talking about, the air opacity outside the leg. Air opacity maybe, if we look at the radiographs on the right, in the intestinal tract. Air opacity perhaps here in the rectum with some fecal content. Fat opacity. The top picture there on the top right is a radiograph of a cat. Cats typically store a lot of fat in their retroperitoneal space. And if cats have a lot of fat, it works as excellent contrast to outline those 2 kidneys over there. So that's the one kidney, and there is the other kidney. It works real well. Dogs have a lot less fat in their retroperitoneal space usually. They store it more in between their abdominal organs or in their falciform ligament. Falciform ligament is also a place where a lot of cats store a lot of fat, typically. In the stifle, usually we have this triangular space here. It's not triangular anymore because this is a patient. Here you just see a little bit of vague. This is just a little bit darker, as you may appreciate, than the structure dorsal to it, or cranial to it, sorry, which is the patellar ligament, and the stuff that's there inside the joint, which is a fusion of the joint. So the fat opacity helps you to determine whether this stifle is a normal stifle or whether there's an increase in soft tissue opacity. And based on this radiograph, you cannot say whether it's fluid or if it's blood or pus, or you can't say if it's fluid or if it's maybe really proliferation of the synovial outlining there of the joint. You don't know. So soft tissue opacity, like the musculature, organs, a fluid-filled bladder, the heart, the cardiac silhouette is also soft tissue opacity. Many things have a soft tissue opacity. An alveolar pattern with the lung bleeding, for example, also gives a soft tissue opacity. And usually inside the chest, for example, soft tissue opacity should be contained to the cardiac silhouette and to the diaphragm and liver. And so being surrounded by air in the lungs, you should have a clear contour. If you don't have that contour, apparently there's something around the cardiac silhouette that takes up as much as X-rays or attenuates as much as X-rays as the cardiac silhouette itself does. So then there's a soft tissue opacity right around it. Bone opacity, clearly of the bones, but sometimes also of mineralized structures in the urinary bladder. And metal opacity, of course, like a plate that's been applied, or an identification chip, which sometimes comes in handy if you're looking at animals that were found somewhere and you want to notify the owner that their animal has been found. So many books help you how to interpret, tell you how different pathologies present themselves on radiographs. I think the BSAVA manuals are wonderful books. They have a lot of pictures. I love my job because I deal with pictures. I'm a learner by pictures. Anatomy is very important. Like I said, the book in the top middle there, it's filled with radiographs and with normal radiographs, and they by number tell you what those structures are, all the lines, and where the different ligaments attach. The one on the left bottom, Miller's Anatomy of the Dog, is kind of the Bible for dogs' anatomy. I'm sure many of you know it. I love the chapter in that book, the first few chapters about the skeleton, about the muscles, because the chapter about the muscles also contains pictures where they show you the bone and little areas. They've colored little areas exactly where the various muscles attach. So if you see a little spike on a bone, a little area of new bone formation, you can look up in Miller's Anatomy of the Dog, or you can look back in your anatomy knowledge, which is very important if you want to do radiograph interpretation. You can look up again which muscle exactly attaches there, and if there's any muscle that attaches there, and if there's not, then you can think of a different differential diagnosis. Thrall, of course, is also a big book, and for horses, the Book of Butler is well known. But there are many more books out there, and they're probably just as good. These are the ones that we work with our students. I'm sure there are other books that are just as great. And of course, the internet is wonderful. It's good to look up stuff. What I've learned, though, is that sometimes the internet is good to look up stuff, but it does serve your short-term memory. For long-term memory and for deep learning, books turn out to be the better option for a lot of students. And it's not something that I came up with, but this is written down in scientific literature. So if you are in the middle of the night doing your duties, it's nice that you have some basic knowledge that you know, because you learned it from books. Okay. Just a couple of short images on my routine that I do. So there are 4 things that I look at. If I look at that thoracic radiograph, like I told you, usually you take the radiograph because you want to know something from inside the chest. So I start with the extra thoracic region, and then I go outward in. I start with a pleural space that you usually don't see on a radiograph. I look at the mediastinum and all the structures it contains, and then I look at the lung. So if I look at the thoracic region, I look at the soft tissues. Do I see any air bubbles in the soft tissues? Sometimes patients already got some fluids by the time they get to our hospital. Probably in your practice, you'll be the one administering them, but you may take over patients from your colleagues. And if you take a chest radiograph, then it's good to spot those type of things. Or maybe an animal was bitten, or is developing an abscess, or any other reason why it has some irregularities there of the soft tissue opacity outside the chest. And of course, the skeleton. And the picture I just showed you, that you're not always looking at the whole picture with the eye tracking drawing under it, is very much true for the chest, because if you want to look at the chest radiograph, you need to look at all the individual ribs, one by one. Follow them, all 26 of them. All. On both views, because of course you will always take at least 2 views. All the ribs, because you will miss small lytic lesions that may be important, that usually are important for the outcome and further workup of a patient. So you need to look at all skeleton, all the ribs. All the ribs, you follow them all. Also the other side, all the ribs. Because the topic I'll talk about later on is forensic radiology, and rib fractures, old and new rib fractures, play an important role in that matter, okay? And they're often missed. So all ribs. So pleural space, you usually don't see it, but search for it. And you'll see that if you're looking for the pleural space, also the pleural space between the different lung lobes, you'll start seeing more often and start recognizing more often those fine lines that separate the different lung lobes. Depending on which machine you'll work with a little bit later on, if you're still analog or digital, and you may start seeing pleural lines even in healthy patients, because as dogs get older, those pleural lines also stand out a little bit more. It may not necessarily represent the pathology, but if you don't look for it, you'll not start noticing them. Okay, so you need to look in order to see. This sounds very philosophical. Mediastinum, so all the structures in there. Some of them you usually don't see, like the thymus in a normal animal, adult animal, you don't see. Though I must say, and one of our residents is currently doing his project on it, we do see some remnants of thymic tissue in more dogs than we anticipated. So that may be a normal finding. But of course, if there's a large mass, it's not normal. Sternal lymph nodes you usually don't see, especially on the DV view. You don't see the sternal lymph nodes, of course, because they're superimposed over the sternum and the other structures. But on the lateral view, you might discover them close to the sternum, just above the second or third sternobra. If they're enlarged. If they're not enlarged, you shouldn't see them. Like the large vessels cranial to the heart, you shouldn't see them. But in the other patients that I just showed you, with the pneumomediastinum, with air inside the cranial mediastinum, all of a sudden you'll start seeing a difference, and you do see those larger vessels coming off the aortic arch. And then we look at the lung, and we try to discover the bronchial walls. We start looking for arteries and veins, lung interstitium, and we try to determine, for example, if we've taken this radiograph because the animal was coughing, do we think there's a lung pattern? Can we stick a lung pattern to it? I always get many questions about lung patterns from the students. It's not something that I can cover in 2 minutes. So maybe there's also a different way, besides looking it up in books or asking your teachers at home. If you have questions about it, you can also look at it in a different way. For example, ask yourself, if you have a chest radiograph, is the lung still loosened? Here in the radiograph that we just discussed, the left lung half on the right side of the image is still loosened. I mean, we can see the vessels run all the way to the periphery, which is normal. We see some of the interstitium, which gives a little bit of a grayish glow over the whole lung. But on the right side, the lung is not loosened anymore. It's collapsed. It's not loosened. It's not aerated. Well, maybe a little bit there in the main stem bronchi, but for the rest, the lung is not loosened anymore. We see the margins of the lung. Of course, we shouldn't see the margins of the lung. We should see nothing of the pleural space normally. Here on the left side of this dog, the right side of the image, we do not see the pleural space. But in the right side of this dog, you do see the margins of the lung. And if you see the margins of the lung, ask yourself, do I see air? Why do I see the lung margins? Do I see them because there's air outside the lung in the pleural space? Or do I see the lung margins because effusion? If you look at chest radiograph, you can also ask yourself, do you see vasculature? If you see vasculature, you can only see vasculature in a lung if the lung is normal aerated. If there's not air in the lung, it's much more difficult to see those vessels. You don't see them anymore because there's no attenuation difference anymore. Or sometimes the lung is aerated, but you don't see the smaller peripheral lung vessels because within the interstitium where those small lung vessels reside, there may be effusion, like edema, sometimes because an animal is in cardiac distress, for example. Just a short view on the time. I think it's about an hour now. just a couple of more slides, and just because then I know the next topic of forensic imaging will start, and maybe that's a good moment to have a short break. Okay, so a couple more slides, hang in there. So I'll tell you a little bit about my abdominal routine. Same goes for the chest. Usually you take a radiograph of the abdomen of things that you want to know about the inside of the abdomen. So I always look at the outside of the abdomen first in order not to forget stuff. So most of you may have recognized that this is a radiograph of a cat. You can see that because of the slender presentation of the lumbar vertebrae. So the head of the cat is not on the picture, but it's on the left side. You can see there the caudal part of the chest with lung. You can see the final ribs, the most caudal ribs. Then you see the lumbar vertebral column. You see the pelvis and the tail. Then you see the front legs. You see that there's a lot of fat there. Extra abdominal there in the ventral abdominal tissues. There's also a lot of fat here dorsal to the musculature. Then we go in, but then be aware that there are two spaces in the abdominal cavity. There's the retroperitoneal space and there's the peritoneal space itself. So the retroperitoneal space in cats, especially in fat cats, has a lot of fat. We can see in normal cats, we can see both kidneys, and then we look at the peritoneal space with all the organs, etc. So the extra abdominal structures, like I said, we looked at the soft tissues, the skeleton. Decide for yourself whether you think the retroperitoneal space is full or empty, and if you can see normal detail, and decide for yourself in the peritoneal space the same things if you think it's a full abdomen or if it's empty, or if there's enough detail. If it's full or empty, I think this abdomen is full because the ventral contour of the abdomen is bulging, and I think it's full because I see a lot of fat in the abdomen. That's the reason. If I don't see a lot of detail, I may decide that it's full because it has fluid in its abdomen. Okay, and then I move on to all the organs, and it doesn't matter which routine you have, or which if you start with the colon, or just do it every time in the same way. You'll see if you've done this in 10 radiographs, it will be easier to follow through your own routine, or my routine, or the routine of one of the books. Doesn't matter. Just do it routinely, and it will help you greatly to quicker get a blueprint in your head of what your James Bond should look like in a abdominal radiograph or in a chest radiograph. Okay, I think this is a good moment for a break. I will apply everything that I just told you in the next couple of slides. I'm going through some patients, and I hope that you want to think along. And let's see, what time is it now? I think it's 10 after 1. Maybe a 10-minute break. Is that all right? So we'll start again at 1:20. And we'll see each other then. Okay. Thank you.
Thank you. So yes, everybody, please stay in this room. Do not leave the lecture, but you can either go grab a drink, go to the toilet, whatever you like. And then in 10 minutes, we'll start again. And we might, because we're taking a break now, we might have a shorter break in between this lecture and the next. But I think it's a good idea to process this before we're going on to the next part. So we'll see you in 10 minutes.
Okay, I'm ready to continue again. I hope you can hear me all.
Yes, we can hear you. And just a short reminder for everybody who's joining, if you don't see what Leonie is pointing at, or if you have any questions, please write them down in the chat or raise your hand, because we might not know if Teams is having a bit of a delay in your screen, and we do want you to understand everything. That's it.
Okay. Next, the second part of my presentation, I'll talk about the area where we also use radiology, and that is the region of the forensic radiology and imaging. So cases where maybe non-accidental injury is suspected, or we want to know what the cause of death is, that area. So it has something to do with CSI, basically. I'm sure that most of you have seen that series. And in human medicine, the forensic area is much more developed, but it's also still growing. And I work together with people from both the human field as far as imaging goes, but also from the human field in the forensic area. So physicians that, for example, do cases where people have suffered abuse, or people were found dead, and it was uncertain if that was a natural cause of death. And working together with those people has learned me a lot, and I'm trying to show you the things that we can do and the things that we cannot do. Okay, so here goes. The center picture, it's actually a fridge magnet. You can buy it. It's very funny, I thought. The picture on the left is an example of a case where sometimes we get not the whole animal, but part of the animal, with the question if we can say something about potential trauma, if we can say anything about the cause of death. Because on the outside of this animal, you may not be able to see that the inside is completely broken, right? This is the skull of a dog. You can see even here that the cranial, the contour there of the brain case is completely damaged. And there are fragments here and there that you can see. And I can see that this is a cause of death. It's not for me to say that. We always do this together with the pathologist, and the things that the things that we find on radiography, we combine with the things that they find on pathology. We try to find the overlap. Sometimes we give direction for the autopsy to be performed, and so we feed each other, so to speak. So this cat, I'm sure you all recognize that there is something wrong with the presentation of this cat. And saying that the cat is in two pieces at the moment is something that's very clear. But there's more to be seen on this radiograph. So I give you a little bit of time to look at the radiograph to see if you can come up with more things that you can see on this radiograph, and that can. So someone found this cat at the side of the railroad track and brought it into your practice, and you decided to take a radiograph. Why would you do that? Maybe because you can see if the animal is chipped. Not all chip readers read all chips, I found, and not all animals are chipped. So your chip reader may give a negative result even though the animal is chipped, or the animal may have two identification chips. I've even had cases where there were three present. So that may be something you want to know. So you would return the animal to its owner, for example, if it's registered. Something else we can see on this radiograph is that this is a fairly young animal. The growth plates are still open. Maybe you can also see that when looking at the animal, But of course, this is radiology, so I don't have exterior images for you. But this is a case where we were asked if we could determine whether this animal was already in 2 pieces before he was put on the railroad track, or that the animal was still alive when it was put on the railroad track. So clearly, this is a case that we do together with pathology, and we hope to come to a conclusion. I don't know the conclusion of this animal, to be honest. So what I'd like you to take home from this presentation this afternoon is, besides hoping that I have triggered you a little bit in opening a book and catching up with your anatomy knowledge, is also that I hope that you learn that if you see a fracture in private practice and the person bringing it in, the owner or maybe someone who found the animal, may not always tell the truth about how that fracture came upon the animal. That may be deliberate, and a lot of times is not deliberate. For example, the person, clearly these are 2 fractured legs. The picture on the left is the lower leg of a Rottweiler. It's the tibia, you can see the fibula here, and in the upper corner of the image you can see there the distal aspect of the femur. In the lower aspect you can see the hock joint. And on the right side, it's the forepaw of a cat, where both the radius and ulna have fractured. Now, if I were to tell you that one of these animals was hit by a car and the other one was not, even though both owners come in with the same story saying the animal was hit by a car. I'll let you look at the images for a little while. And I hope that you look at the images trying to determine which animal you think was hit by a car and why, and what would be the things that you would look at. Sometimes an owner finds an animal with a clearly fractured leg because the leg is in an odd angle, and they bring the animal to you and their story is that the animal was hit by a car. Not because they saw it happen, but because that's what they think happened. Because fractured legs always come from hit by cars, but that does not necessarily have to be the case. The animal may also have been suffering from abuse. Or let's look at the left case. So the Rottweiler case, he was found at the bottom of the stairs, so not hit by a car. He was found at the bottom of the stairs, and the owner's story was he fell down the stairs. They didn't hear it. They just found the dog at the bottom of the stairs, and they assumed that he hurt himself by falling down the stairs. If you look at that leg, I see a fracture margin there. It's clearly demarcated. I don't see any callus formation, which is important to state because callus formation takes at least 10 days before you start seeing that on a radiograph. So if you don't see callus, the fracture must be younger than 10 days, which is good to know. So we'll have other examples that I'll talk to more callus formation about to you. So this animal, it happened today, the owner states. I think that can be true because it's a fresh fracture margin. The fracture ends are very sharply demarcated. But if I look at the structure of the tibia proximal to the fracture, it has a smooth bony structure. If I look distal to the fracture, I have the idea that there is some osteolucency there in the distal tibia. And for a Rottweiler of this age, at this location, well, not necessarily this location, but at the end of the bone, this can represent a malignant bone tumor. So maybe more likely, besides the animal falling off the stairs, it could be that he misstepped because they hadn't heard anything. Maybe he misstepped and the bone had lost so much of its strongness, or it's become so weak that because of the twist that it made, it snapped. And of course, it shouldn't do that in a normal bone. So this animal has a pathological fracture. Now, mind you, a lot of times with those pathological fractures, we can see that osteolysis is around the level of the fracture. In this case, it's a bit different. So I guess not all the animals follow the books. And important to remember that at least 30% of the bone must be gone before you start seeing it on a radiograph. So that's a lot of bone being gone. So not seeing clear bone loss near the fracture margins does not necessarily say that there is no bone loss at that level. It's just that we don't see it yet on the radiograph. So on the right, that was a cat that was found in the bushes. And the person who found it assumed it was hit by a car. So they come in with a story, this cat is hit by a car. So you do your physical exam and you look at its paws and you see that all, as you can see also on this radiograph, you can see that its distal phalanges are kind of scratched away. They look horrible. So it looks like the animal, well, could very well be hit by a car and kind of scratched its toe. The fresh fracture, sharp fracture margins, no callus formation, meaning it happened recently over the last 10 days, probably very recently, because the fracture margins become a little bit vaguely outlined in the course of the days after the fracture starts or is brought upon the animal, because of resorption of the cell layers at the level of that fracture, because they're dead, so they're being resorbed by the body. So 2 different fractures. I already told you the solution to this puzzle. So what would you do if you were to put a plate on one of these 2 fractures? I would hope you to choose the right dog, of course, because here is also a fresh fracture, sharp margins, no callus formation. I think in this animal also the fibula is broken, as where in the dog on the left side, the fibula is still intact. So it seems. I'm not going to go into detail of surgical therapy. I'll leave that to our colleagues. But you can see that the structure here of the distal tibia looks much more normal, or as I expect it to be when I compare it to my blueprint, compared to the other dog. So I put a splint on the right dog, and I put a splint on this cat. Or I'm not into surgery that much anymore, so I'll leave it to my colleagues. What I do see in the clinic where I work, I do see quite a lot of animals come back for checkups after they've had surgery. And that's, for me, very informative, because that way I do see what a normal fracture healing looks like in the course of time. So on the left, you see a plate that I applied and pins, and on a fracture, you see the fracture line there still. The ulnar, there's not much displacement. But as this animal is using its leg, there will be a lot more motion at the level of the ulnar fracture, so on this fracture, and on the level of the radial fracture, because this is really kept in place very tightly by that plate and all those screws that I put in. So if this animal comes back after so many weeks again, you can see that there's not so much callus formation. My apologies for the not so ideal or not really comparable radiograph, but I think that you can appreciate that there's a lot more callus formation here on the ulna than there is on the radius. And that is really because there's a lot of motion, a lot of movement at the level of the fracture. So the periosteum is lifted, probably because of the initial impact, and also because of the movement. There's much more callus formation. And that's also something you see back in a lot of rib fractures. Actually, a lot of rib fractures, they have a lot of motion. So you'll see quite some widening of the fracture line before it narrows back again when it's completely healed. So again, an example.
Just a reminder, we have 10 minutes left, because then I need to open another room for the next lecture.
Okay, thanks. So I'll skip this example. I talked to you about this radiograph. It's good if you have a patient, a traumatic patient, on your table and you're wondering whether the owner or not is telling the truth, to look for additional symptoms of trauma, like pneumothorax, pleural effusion, lung contusion. You can all appreciate those on the radiograph, and you can see those more frequently in a motor vehicle accident than in non-accidental injury abuse cases. Just quickly, we're going to skip this radiograph. This is an interesting one. Here, a chest radiograph. We can see the spinous processes here in the middle. We can see the ribs on the left and on the right. We lost the contour of the cardiac silhouette there. And we lost that because there is pleural effusion. You can see withdrawal of the lung margins there from the contour of the chest, and there's pleural effusion. Also, you can see this increase in soft tissue opacity there outside the thorax, and there is air there in the soft tissues. And also, very interestingly, you can see a lot of callus formation around those ribs. So this owner comes in with this dog saying, oh, he's not feeling very well since yesterday. I'm not too sure, because that callus formation must be a lot more older than 10 days, because you can see it so well. It's actually quite sharply marginated. Callus you start seeing around 10 days, but before it becomes really opaque and sharply marginated. This process must have been there at least a couple of months. Now, this was a very big abscess of a kebab stick that stuck from his stomach all the way through his chest and started to make its way out of the body at this level. So it's been irritating with the infection surrounding it, those ribs, for quite some time. This is not something that happened yesterday. It can be that the owner hasn't noticed it because the animal, for example, is an outside dog, they've been away, or other reasons. But I think it's important to note that it did not happen overnight. Nice to compare again to our normal. On the top, you see an abdomen of a cat with a lot of fat. At the bottom, you see an empty abdomen with no fat at all. Full abdomen, it may be fluid. May also be that it's a young animal, considering that this animal still has open end plates, and the fat in the abdomen of young animals is attenuating as much X-rays as soft tissues. Sorry. Okay. Things are not always what they seem. So this bird food outside was gone the next day, but it was not because of the birds, because of snails. Things are not always what they seem. This is a drawing on the floor. This person is not hanging, of course, from a wall. And it's very important that you recognize superposition, zebras, but also in radiographs, of course, in structures, and that you take additional views, because it's quite important what you miss. And it goes also for fingers. In this case, this is the second view. You miss a lot of stuff if you don't take two views. So radiography, we used in forensic radiology and imaging, we use mostly radiology and CT. We can see metal objects. We can, like I just discussed with you, fractures, whether they're old or new, maybe they're traumatic. Are there other signs of acute trauma? This is a nice case. A 2-year-old border collie. Sorry, I forgot to translate this. It's a 2-year-old border collie and was hit by a tractor, or so the owner says. So we see a couple of things. You see here the lumbar vertebra, the pelvis, hind legs. Clearly, one of them is fractured. There's a lot of increase in soft tissue opacity around that fracture, but on the other side, you can also see there's a sacral fracture. And this animal did not want to stand up anymore, it couldn't stand up anymore. And if we looked a little bit closer, you could see there's this step at the edge of the radiograph. So look at the whole radiograph always to get the complete picture. We can do CT. We can look for skeletal changes, gas, metal, or other foreign bodies. Free fluid, no superposition. We can do postmortem CT in animals. We can do 3D reconstruction. Sometimes that's nicer to look at in a law court, for example, what happens a lot in human cases. You can see ballistic cases. You can determine the trajectory of for example, a bullet through the body. And of course, it's not for everyone. You can also do PMCTA. This is really in human medicine, so I'm just going to leave that for now. And postmortem MR is also really in human medicine. Cases of shaken baby syndrome, for example, you can determine brain changes, human medicine, but hopefully veterinary medicine not too far away. Important message. There was a study done where they compared 426 motor vehicle accidents and a trauma they found in small animals on those cases compared to animals that were suffering from non-accidental injury. So look at this picture where they found the fractures of those animals that were hit by a car. They're in different places than animals that were suffering from abuse. So these 50 animals that were suffering from non-accidental injury, fractures were more to the front of the body. They had rib fractures, not necessarily grouped together as in motor vehicle accidents, but on both sides of the body, and also different stage of healing, different age, new and old fracture. Yeah, that's what I said. That animal, this is what you get sometimes. Gas production after death may complicate interpretation. Also, it's more difficult to put them straight, of course, because they, because of the rigor mortis. Just going to skip this for now. This is an important message. If we're talking about animal abuse, people abuse is around the corner. A lot of women who were in battered women's shelters found that a survey of these women found that in a lot of cases, also the pets were suffering from abuse. This is in Dutch, I just realized, but it says the same. And people with violence towards animals were at higher risk for exhibiting violence towards people. It's good to keep that in the back of your mind. I just want to show you this case, Chrissy. Chrissy recently suffered from some hematomas in the eyes of the neck, often good anymore. This afternoon, the owner heard a loud noise, a big bang, and the dog was found on the ground. And the owner assumed that she ran into the staircase. And the local vet referred the animal and the owner to our clinic. After the accident, the owner tells us that she was trembling and she was in lateral recumbency. She did not respond to the owner, but she was also she was still conscious. She was not fainted or anything or blacked out. And while in the room at our clinic, she gets more responsive now in the exam room. And because the animal was reported background, something the owner mentioned to us, we decided to take a radiograph. So we take a radiograph of the back and of the pelvis. And if we look at the pelvis, you can see this fracture here, just called to the right as the tabulum. It's an old fracture. It's a lot of callus formation. We can still see.
We have 2 minutes left.
Yes, thank you.
In 2 minutes, I'll close the room.
Okay. So there's an old fracture there. But there's also an old fracture here in the rib. And that's caught our attention. So we decided to open up the scan a little bit more. And not only this rib was fractured, but also this one, and this one, and this one, and these. And here on the other side, multiple rib fractures, multiple amount of callus. Fibula was fractured right over there. And the distal ulna was also fractured. The owners deny that they know where these fractures come from. The dog has been with this owner since she was young. Owner has a new partner. Fortunately, there are no children in the family. And this animal was reported and confiscated. So animal abuse, think about child abuse. So notify your local police authorities, for example. Animals are sometimes afraid of the owner, but not always. And sometimes it's a single injury, sometimes repetitive. And I think this is a good moment to stop. Yeah, I had some other cases, but unfortunately I didn't have time anymore. But let me know if you have any questions. You can do it in the chat. I'll keep an eye on the chat, and I'll hope I can answer them for you. If not, I'm sure you can find my email via the IVSA conference people. And thank you very much for your attention.
Thank you very much for the lecture, Leonie. It was really interesting. And indeed, if people have any questions left, they can message us and I'll get the questions back to you. So don't worry if you have any questions, we will give them to Leonie and then we'll get the answers back to you. I want to thank everybody for joining us. I'll delete this meeting in a minute, and then please join the next meeting, of which the link will be sent to you in 5 minutes by your email. So Leonie, thanks again. It was really interesting. Too bad we didn't have half an hour extra, but that's I still think everybody learned a lot about radiology and about the forensic cases.
Yeah, good to talk about this for days.
Yes, probably. Okay,
Sorry.
thank you.
Okay,
bye.
so enjoy the afternoon, and I hope you guys listen to more interesting lectures. Thank you. Thank you for inviting me. All right,
Nice day.
bye-bye.
All right, so I think we'll just begin the presentation now-ish. People will keep piling in, hopefully. They should all have received the link by now, and we have let them know. So this session of Purina Innovations and Purina Talks is gonna be a two-parter. We're gonna start out with a presentation by Daniel, who's from Purina Institute. And Daniel graduated from the veterinary faculty in Zaragoza, Spain. And afterwards, he spent 5 years dedicated to research several areas impacting pet health and animal welfare. He followed this up with a PhD at the same university he graduated from. He was subsequently appointed as a technician for scientific services in different pharmaceutical companies in the pet health sector. And he moved to a regional and global marketing and technical position where he has a strong communication role and has had that for the past 15 years. He's had several certificates and awards during his long professional career with a special focus in the area of science, marketing, and communication. And with those few words, I will start sharing my screen and we'll see the first video lecture here. So what's going to happen is we're going to have the first lecture by Daniel. It is pre-recorded, but he is here, so ask questions in chat and he should be able to either answer them himself or say something. Then we're going to have a very, very short break where we introduce the next speaker. Jennifer, she's not here at the moment, but she will be joining later. Then we'll watch her lecture. And at the end, we'll have a Q&A session where you guys can ask all the questions you might want. But without further ado, I will start the presentation now.
Hello to everyone. My name is Dr. Daniel Rhodes, and it's a tremendous pleasure to run this lecture today. So I'm going to talk about the power of nutrition and feeding our cats and dogs. The role of the Purina Institute is that we are the voice of Purina science, and we believe that science is so much more powerful when it's shared. At Purina Institute, we consider that sharing the expertise and credentials of Purina in the area of pets nutrition helps to the scientific community and also to veterinarians advancing science for pets' health. As a global professional organization, our mission is to advance nutritional science to help pets live better, longer lives. Our foundation is based on 3 pillars that I will briefly review, allowing you to figure out the relevant role that the Purina Institute plays as part of Purina, one of the world's leading pet care companies. Purina has been a pioneer in the science of pet health for almost 1 century, with breakthroughs that have been redefined the industry's standards of pet nutrition. This track record helps to ensure that the Purina Institute voice is built on a solid foundation of science. Some notable examples include developing the first nutritionally complete and balanced dog food in 1926, and also the first weight loss diets using high protein in 1992, as well the first diet to promote cognitive function for dogs in 2010 and for cats in 2016. And also it's worth to mention the 9-point body condition scorecard, which has become a global industry standard for assessing pets' weight and how this affects the overall health. So Purina continues to demonstrate that nutrition is instrumental in promoting everyday health, as well as helping to nutritionally support chronic conditions in pets, and some examples such as epilepsy, diabetes, or obesity. So the image in the slide is just a summary of some of these relevant breakthroughs as an example of the solid scientific credentials reached by Purina. At the same time, the Purina Institute is representing a diverse team of more than 500 scientists and pet care experts around the world. That means we are representing a globally diverse team of experts from a variety of disciplines, including veterinarians, nutritionists, biologists, immunologists, and specialists in new trendy areas such as genomics and bioinformatics. Our scientists are distributed in 8 R&D facilities around the world, covering the 5 continents, something that is quite unusual in this segment. In more than 100 years dedicated to research, Purina has also published more than 500 papers in scientific journals and currently has 7,700 granted and pending patents worldwide. This track record provides a solid foundation of research for a great impact in the global veterinary community. And regarding our third pillar, the principal objective of the Purina Institute is to share Purina's research and the latest scientific findings in pet nutrition with veterinarians and also with other pet professionals. And that means the Purina Institute is covering relevant areas of health, such as brain health, gastrointestinal health, and molecular nutrition. But also Purina is very active searching for future innovation in new promising areas of research that will provide us with new assets in the area of pet nutrition. So the Purina Institute will communicate the latest science behind these and other important areas of pet health, because it believes science is more powerful when it's shared. We translate and amplify Purina's science so that pets and the people who care for them can benefit from the learnings. And now, talking about the power of nutrition and feeding our cats and dogs, we need to consider that unlike ourselves, we were feeding our cats and dogs, then we have almost 100% control over what goes into their mouths. This is when we can really demonstrate what nutrition can do. And over the last 20 years, there has been a significant evolution both in our understanding of what nutrition can do, but also the technologies that are available for us. So maybe 20 years ago, we got excited about specific ingredients and what they were doing, and then we started looking at specific nutrients as part of those ingredients. But today, we are beyond that. We talk about molecular nutrition, and through technologies like metabolomics, we can now look at metabolomic pathways and identify anomalies in some of those metabolites to give us those insights to say, is there something that we can do from a nutrition molecule and nutrition intervention to help with this specific issue? So now I'm just going to give you a number of different and diverse ways where nutrition can not only have an impact on the cat and the dog, but also on those pet owners that love them. And the first example today I'm going to give is not the actual diet itself, but is all around how we feed and the amounts we feed. In fact, even though it seems an incredible claim, it's an actual fact that if we keep dogs lean from puppyhood throughout their life, we can actually extend their life. So Purina undertook a 14-year longevity study with Labrador retrievers. And these Labradors were basically split into 2 groups. Everything was absolutely identical between the 2 groups. The only thing was that one group were kept in a really lean body condition, and the others were kept at the typical Labrador size. And what we were able to show was that at the end of the life, we could actually extend the life of those Labrador retrievers by nearly 2 years. And also, we saw a really delay in the onset of the clinical signs of chronic disease, including the severity of osteoarthritis, a delay in the times where you actually saw the decline in lean body mass, and also in the immune function. And this was all simply done to keeping those dogs lean. And I haven't got time to talk about it today, but actually there is over 25 peer-reviewed papers that come out from this study, with a lot of more insights that we were able to show following those dogs. But the key thing was keep them lean you can actually extend their life. Now, I want to talk about the impact of nutrition on cognitive health. And this is an example where, again, we are much more advanced in our understanding about what we can do with our cats than what we can do with humans. So even when we are looking at the developing brain, when the puppy actually has achieved 90% of its adult mass by 12 weeks of age, that if we can actually use the DHA, so the DHA is an omega-3 fatty acid, that is a key component of the gray and white matter in the brain that is associated with memory and learning. So then we did a study where we actually fed puppies from 3 to 16 weeks of age with the DHA. And then we compared them to the cohorts with their litter mates that were not fed with the DHA. And in a maze test, the actual puppies that were supplemented, they completed that maze 25% faster than their litter mates. So that is the impact that we can have on the developing brain. But I think where we can really have shown big advancements is how we can take nutrition to actually slow down the brain aging. So the healthy brain is a huge consumer of glucose. It's its primary energy source. But from around about 7 years of age, the ability to use glucose starts declining. And this results in the cells essentially being starved. They basically will die. And then ultimately, this is when we see the clinical signs of cognitive dysfunction as the dog ages. So what we wanted to do was to say, could we actually find an alternative energy source that the aging brain can use? And this is where we looked at medium chain triglycerides, which are actually converted to ketone bodies, and those that can actually be used as preferential energy source by those aging brain cells. So in a study, we actually took dogs that were 7 years plus, and we actually fed them two different. We fed them with the MCTs, the medium chain triglycerides, and then we put them through a series of cognitive tests. So we were looking at their coping ability, their interaction, but also their memory. And what we were able to show was that the dogs that were supplemented with the MCTs, not only they made fewer errors on those tests, but actually we show more significant differences when they were on more complex tasks. And additionally, we were able to see improvements in memory in as little as 2 weeks. So this again is a nutritional intervention where we can understand how we can provide a different energy source through the diet that will help the brain and essentially slow down brain aging. So you may ask, what about cats? Well, indeed, we can do cognitive tests with them. But instead of using the MCTs, what we looked at here was a different blend. So this is a blend of fish oil, B vitamins, antioxidants, as well as arginine. We included middle-aged to older cats. And at the end of the year, going through different tests, whether it was coping or visual learning, again, we saw that those that were on that specific brain protection blend, they made fewer errors in that cognitive test than those that were not supplemented. And then, finally, I would like also share how nutrition can actually help with brain disease. Now, for all of you, you're aware that these are probably the most challenging cases that you have in the clinic. We collaborated with the Royal Veterinary College in London, in the UK. And what we were working with was the really difficult cases, the refractory epileptic cases. And what we did is we kept those animals on the same drugs. So we didn't change the drugs. The only thing that we did was we fed them with a diet that was actually containing these medium chain triglycerides, the MCTs, as well as a few additional other brain nutrients. And in as little as 90 days, 71% of those dogs saw a reduction in seizure frequency. But even more powerful was that 14% of those dogs went seizure-free. And this is an example where you are not just changing the life of that dog, but the owner and also the vet. So again, this was where we are actually feeding the diet. They kept them on the same drugs. So you could see just by feeding the diet, this is the impact that it had on these cases. So now I wanted to talk about the microbiome, because this is an area where we have only just touched the surface and understand how nutrition can play a really key role. As many of you are aware, microbiome is involved in many physiological cases and processes that are vital to the actual host. Not least that we get 10% of our energy actually from the microbiome. But also, we are seeing more and more papers which are demonstrating that changes in the microbiome are linked to diseases, both in humans and in animals. So in the slide, you have seen the cases where we are looking at microbiome with the IBD, asthma, and obesity. But the area that we found really interesting was that there was also insights to show that the microbiota, the actual bacteria, is also involved in neurodevelopment conditions. And we are getting much more insights now that there is a connection between what is the actual crosstalk between the gut and the brain, and probably you have heard about the gut-brain axis. So one of the great things about being part of the bigger Nestlé is the fact that they have been working in the area of probiotics for over 30 years. So this gives us an opportunity not only for a transfer of knowledge, but also opportunities to leverage own cell cultures. And then, just to finish, I want to talk about another nutritional intervention. And this is really came from something that is foundational to Purina, where we believe that not only pets and people belong together, but they are better together. And one of the unfortunate things is that globally, up to 1 in 5 adults are actually allergic to cats. And this has a real impact, not just obviously on cat ownership, it also impacts cat relinquishment and those people that have allergies to cats and keep their cats. And there are many of them, but it also impacts the cat owner relationship that they will have. Now, by the way, 95% of the cat allergy instances are down to one allergen that is called FeLD1. And this FeLD1, by the way, is produced by every single cat. So there is no such thing as hypoallergenic cats. Even hairless cats produce FeLD1, and it's produced primarily in the salivary and in the sebaceous glands. So what we challenged ourselves was there some way that we could actually neutralize this FeLD1? Because what happens is that when it's secreted in the saliva, when the cat grooms and then transfers the FeLD1 onto the hair, and then when that dries, it gets entered into the environment thanks to the shed hair and dander. Now, what we don't want to do, because we don't know what FeLD1 actually does, we don't know what its biological role is in the cat. So the last thing that we wanted to do is look to stop the production. And we certainly didn't want to impact the cat's physiology. But we thought, is there some way that we could actually find a way to neutralize FeLD1, but after it has been produced in the saliva? So this has been over 10 years of research. In that time, we went from bench top right the way through the actual studies in the cat. And essentially, how this technology works is that we leverage a very safe and proven technology, which is actually using antibodies IgY. And that we wanted to do is to produce a specific antibody against the FeLD1. That was the start of the work. And then what we were able to demonstrate was that by producing this specific anti-FeLD1 antibody, taking an egg product ingredient that contained it, then we coated it on the outside of a dry kibble so that when the cat actually shoot the food, the antibody then bound to the actual salivary FeLD1 in the cat's mouth. So that when the cat then started grooming, the neutralized FeLD1 is actually distributed on the cat's hair and dander. So that when it's actually released into the environment, it's no longer recognized as an allergen. So that was the whole premise behind what we did. And through our studies, this culminated in a study that was published in 2019, where we were able to demonstrate that by feeding these cats with kibble that had been coated in this egg product ingredient, which contains this very specific anti-FeLD1 antibody, that we could actually significantly reduce the amount of active FeLD1 on the hair and dander, starting in the 3rd week of feeding that diet. And we could actually reduce it by on average of 47%. So the key thing here, and it's important to say, this is not a panacea. So when people have sensitivities to cats, they are really undergoing lots of different management ways to actually help reduce the allergens. What this is offering up through a nutritional intervention is a new approach that can actually neutralize the amount of active FeLD1 that enters into the environment. And I think that, again, this really just demonstrates the real power that nutrition can do, that we can actually use a nutritional component to even help reduce something that the cat is producing, but by the way, after its production, without actually changing the cat's physiology. All of us are aware about the critical and important role that nutrition plays in the area of health and well-being of our cats and dogs. But the actual awareness of that, the true power and the impact that nutrition can do is still relatively low. In some global research, we found that less than 1 in 4 veterinarians around the world proactively talk about nutrition to their clients. And if veterinarians shy away from these conversations, then pet owners are going to go to other sources of information, like Dr. Google. And that is a real shame, because 83% of pet owners also told us that they completely trust about the information that they get from their vet, and yet less than half of them receive it. That is the reason why the Purina Institute has created purinainstitute.com. It's a global website. It's a source of information dedicated to solve the most frequent issues and trendy questions about pets' nutrition. This website is open access and is regularly updated, and it contains scientific summaries, reports, videos, publications, and downloading materials with a proper understandable language to inform veterinarians, nurses, and also providing them with adequate skills to educate pet owners in the area of pets nutrition. So I just want to finish by saying it's really important to have nutrition conversations. It's very different when we are feeding our cats and dogs, when we have so much more control and we are so much more advanced in understanding that real powerful impact it can have on their health and well-being. And as with everything, science is much more powerful when it's shared. Thank you.
So that was the first lecture, and we do have a few minutes if you guys have questions right now. No one has written anything in chat, but
Hello,
other
Daniel.
than that, it should be good to go.
Hello to everyone. Thanks, Daniel, for the introduction you did before to me, and it's a fantastic, tremendous pleasure to join you in this session, in this event. So for me, it would be fantastic to answer any question that comes from the audience. because you know the objective of the Purina Institute is just to share our expertise with the veterinary community. So being a diamond sponsor of the IVSA group is a great opportunity to us to collaborate with you. Okay. So happy to answer any question.
Yeah. So we have a question from Ali from Iraq, I think. You can unmute yourself now, Ali.
Thank you so much for the presentation. It was very awesome. And it's the Kurdistan region of Iraq, not to be racist or anything. One of my questions is the main thing that we talked about were, you know, cats and dogs. But what about avians and exotic birds?
That's a good question. To be honest, the company is mainly focused on companion animals, referring to dogs and cats. So the expertise on other animals is not so remarkable. No, it's true that we have dedicated some research in wild animals, referring to wild cats, for example, in order to understand the behavior, the metabolism, and these kind of things. But in terms of other kind of animals like rodents or avian species, the company has not dedicated so much effort on that. That doesn't mean that in the future, perhaps the company is going to extend the coverage to those species, no? But it's a good question, because we know that from a veterinary perspective, there is more and more interest on those species, no?
All right, we have a question from Merel Knopes as well. How does Purina decide what diets they do further research on, and what are some of the next topics we can expect?
Good question also, Meryl. You know, one of the strong pillars of the Purina Institute is that we have a close connection with Nestle, and Nestle has an incredible area of dedicated to research. No, so we are interchanging continuously knowledge around nutrition and how nutrition impacts humans, dogs, and cats. And at that level, we are making a kind of extrapolation how the nutrition can provide some benefits to dogs and cats. And we know that, for example, the omics territory is an area that is going to provide us tremendous opportunities, potential solutions for the veterinary community, and is the area where Purina is dedicating a tremendous effort. Also in the area of microbiome, because as you show in my lecture, the microbiome is incredible area, no? Where we don't know currently exactly the limits of the impact and the influence the microbiome has on different areas in the organism. For example, we know that even is having an influence on the brain activity, but also in the oral cavity, and also in general in the metabolism of the organism. No? So we have identified some territories where in the future we expect to provide to the veterinary community with some nutritional solutions.
All right, so I think we're only going to do one more question, and then we'll save your other question for afterwards, Ali. But Mayan Rua asks, what are your thoughts on using natural supplements such as Boswellia serratia or turmeric as a nutritional supplement in the management of osteoarthritis, please?
So the osteoarthritis is, we know that is a huge area in veterinary medicine, no? And unfortunately, there are not so many solutions because we have surgery or we have some the option to mitigate the evolution of the pathology. No? So we know that there are some ingredients that are having a associated benefit, especially slow down, making a slowdown of the evolution or reducing the pain, the local inflammation. So you are mentioning some specific ingredients. So I would need to check with the research team if we have any experience on those. But clearly, it's a territory where Purina has been dedicating some efforts in order to create some supplements, some solutions that clearly have demonstrated some benefits in the osteoarthritis. No.
All right, so with that, I think we're going to go on to our next speaker, Jennifer. She just turned on her camera, so now you guys can see her as well. All right, so Jennifer finished her veterinary degree in 2010 and her residency program in small animal nutrition back in 2016. She is a PhD in veterinary medicine and has worked as an associate professor in pet nutrition in the veterinary school of Barcelona. Yes, where she's also managing the research line in pet nutrition of the Animal Nutrition and Welfare Services. And we're going to hear a bit more about the Purina ProPlan innovations, such as the ProPlan, NeuroCare, and veterinary diets, cardio care, so on and so forth. And I think we'll just start with the presentation now, and then we'll do questions afterwards, just as we did with Daniel. Do write questions in the chat if you have them while we're watching the presentation. That way we don't have to interrupt it. All right, when we're going. Well, that's on me. We're gonna try again without me failing miserably. Include computer sound. There we go. It's a good option to include. And there you go.
Hello, everyone. My name is Jennifer Molina, and I'm the Vet Educational Manager at Nestlé Purina MNA. Today, I'm here to talk to you about the main latest innovations that Purina ProPlan Veterinary Diets has on its portfolio. And I want to thank, of course, to all the IVSA organizers to let me give you this lecture. So let's start. So first of all, we know that Purina has a big history of innovation. So it started in 1926 with the first complete and balanced dog food that was done by Purina. Continue with, for example, the first weight loss diet for dogs, or the first to use hydrolyzed protein to help manage allergies. But I'm not going to go in depth with all of them, and I'm going to focus on the three main ones that we have on the latest years from Purina ProPlan Veterinary Diets. So the first one will be the first clinically diet proven to help with the management of canine epilepsy. The second one, a dietary supplement to increase water intake and urine dilution in cats. And the third one, a diet proven to improve cardiac function in dogs with mitral hair murmur. So without more delay, we are going to see CardioCare, NeuroCare, and HydroCare, the three latest innovations from Purina. Let's start with NeuroCare. So NeuroCare is a diet to support brain function and age-related cognitive decline in dogs. Okay. So the main benefits and characteristics of this diet, NeuroCare, the main thing that it has is that contains MCTs. Okay, so MCTs, they are ketogenic, or this is a ketogenic diet because MCTs are providing an alternative energy source for the brain. Then as well, it's formulated with these MCTs, but not only MCTs, but as well neuroprotective nutrients that are clinically proven to help enhance brain function. And as well, regarding the cognitive function, it's especially formulated to help cognitive function in senior dogs with visible results in 30 days. So if we go a little bit more in depth on the mechanism of action, how dietary MCTs, medium chain triglycerides, can provide an alternative energy source for the brain. So I want to show you this video that it's from courtesy of the Purina Institute to understand a little bit better why this is happening.
Canine epilepsy can be a devastating chronic brain disease that can severely affect the quality of life for dogs and their owners. It is also a frustrating diagnosis for veterinarians to deliver, because up to 30% of patients remain uncontrolled with current therapies. Epilepsy is characterized by recurrent seizures, manifestations of abnormal hypersynchronization of neurons in the brain. Glucose is the main source of energy in the brain. During seizures, however, normal brain glucose metabolism is disrupted. Moreover, the hypometabolism of glucose between seizures may be linked to imbalances in neurotransmission and changes in the excitability of neuronal membranes. Groups of hyperexcitable neurons may fire erratically, causing electrical storms of activity that drive fresh seizures. Dogs can use a specific type of fat called medium-chain triglycerides, MCTs, as an alternative energy source for the brain. MCTs are metabolized into medium-chain fatty acids, MCFAs, in the intestine. MCFAs travel to the liver, where they are primarily converted into ketones, such as beta-hydroxybutyrate. Ketones enter the systemic circulation and cross the blood-brain barrier, serving as an alternative energy source for the neurons. Another proposed mechanism acting downstream of MCT ingestion may involve the beneficial activity of a specific MCFA, decanoic acid. This molecule is thought to inhibit the AMPA receptor, which helps propagate excitatory impulses between neurons. An AMPA blockade may help calm the electrical storm and contribute to seizure control. In a collaborative study, the Royal Veterinary College and Purina enrolled epileptic dogs currently not well controlled despite use of anti-epileptic medication and fed them a diet containing a proprietary blend of MCTs. 71% showed a reduction in seizure frequency, and 14% of them became seizure-free. This nutritional innovation offers a new approach to improving quality of life for the dog, the owner, and the veterinarian.
Okay, great. So I hope that now it's a little bit more clear, right, that the medium-chain triglycerides are passed to medium-chain fatty acids, and from there, via porta, they arrive to the liver, and then from there they go as well as the ketone bodies to the brain. Okay, so this is a little bit the process. So which is the science behind these MCTs? We have listened already on the video, right, that there was one study, this is a study done as well with the Royal Veterinary College and Purina, but there are more. So we have already these two main studies, let's say, testing with NeuroCare. So one is the one that you have already listened, right, with the 71% of reduction in seizure frequency, with the 14% with the complete seizure freedom and more than 50% reduction in seizure frequency, which are great results. Then as well, we have this article that was published by us as well, as you can see my name here, and it's a 90 days prospective study, open label single arm food study. And then in this case, we saw as well that the mean seizure day rate was decreased by 42%, and the mean seizure frequency per month was significantly declined by 32% as well. Then this third study is not done by the Purina group, but is done by the very well recognized as well neurologist group. So in this case, what they were trying to see if it's an MCT supplement, not the diet, can as well improve, let's say, seizures frequency, right? So then it was a 6-month multi-center study. And in this case, what they saw with this supplement is that the seizure frequency was significantly reduced, which it's fine, but none of the dogs became seizure-free or show an overall reduction in seizure frequency more than 50%, okay? So then it looks like, okay, maybe you can add this kind of supplements, very concentrated, let's say, on MCTs, but we're not doing, let's say, the same big effect that with the diet. Taking account as well that not all the medium chain triglycerides are the one doing the effects, okay? Are some specific medium chain triglycerides, which are C8 and C10, that we purified and then we give to the animal. So it's not as simple as catch coconut oil and give it to the animal, because coconut oil has more C12 than C8 and C10 that are the ones that we want to include there. So just the key points. So we have as well science behind. So we have been talking a little bit, no more on epilepsy, maybe on this issue, but there is science behind as well with CDS, cognitive dysfunction syndrome, and medium chain triglycerides. I'm not going to go in depth with any of those, but here you have all the references. And in case that you want more information, you can just ask me. But we have as well many studies, let's say, seeing that medium chain triglycerides can be effective as well on the cognitive dysfunction syndrome. So this age-related cognitive decline as well that we call is similar, let's say, to the brain Alzheimer's disease in humans. And it's characterized by a progressive cognitive impairment beyond that expected to occur with the aging. So an estimated 14% of dogs age 8 and over are affected with this age-related cognitive decline, or CDS as well, but only 1.9% are diagnosed. So this is something that we need to take in account, okay, that the diagnosis is very few. Why? Because it's very difficult. Okay, it's difficult sometimes to recognize these dogs on the previous stages when they are not really with a high level, or when they are really have a cognitive dysfunction syndrome in the more severe phase. So then Purina, in order to try to help you, and together with a very expert group of behaviorists, okay, that is this CAWEC that you are seeing here, with Xavier Manteca, Marta Mat, and Susana Lebrec, we did, well, they did, let's say as well for us, a scale, okay, which is the canine cognitive assessment scale. And this scale, what it means is to, or what aims is to, let's say, differentiate the stages of the cognitive impairment. So if it's normal aging, is a mild cognitive impairment, or is a severe cognitive impairment, because this is what makes the difference, okay? So in order for a dog to be diagnosed with CDS, cognitive dysfunction syndrome, pet owners must observe their dog exhibiting specific behaviors. So this scale that they have created, these experts have created for Purina, identify these behaviors, enable veterinarians and owners to work together to assess a dog's mental activity. So a clinical trial has been already done to validate the scale with very good results, and the publication will be published in a peer-reviewed journal very soon. But as well, let's say at the end of this year, we will have a QR code available, a campaign with a QR code available, so everyone with the mobile catch the QR code and do the scale, and then present the results as well to their pets. Okay, so these are the actions that Purina are doing regarding as well neurocare to help as well vets with the recognition of brain issues, and in this case as well with age-related cognitive decline. If we go to the next innovation now, that it's cardiocare. Cardiocare protects the heart from the start, right? Because it's an early stage, let's say as well, cardiac diet, but we are going to see that it can serve as well for more advanced stages. So first of all, I want to mention that the energy requirements of the heart are very high, because the heart needs almost twice as much energy as the brain. And the brain, you know, that needs very high amounts as well of energy. So hearts are hard-working muscles because they don't stop. They beat about 60 to 120 times per minute. So it is about 1 billion beats in a lifetime. So they are not stopping at all. So it's very important to understand the requirements that it has. So we know as well for the prevalence that 1 out of 10 dogs have heart disease. And the most common heart disease in dogs is the myxomatous mitral valve disease, with the 17% of the dogs with heart disease diagnosed with this MVD. And almost 100% of the Cavalier King Charles Spaniels are diagnosed with this MVD. Okay, so this is especially important as well for them. So what we have, let's say, on this innovative formula, we have this cardiac protection blend that contains medium chain triglycerides as well, key amino acids, magnesium, vitamin E, omega-3 fatty acids, and taurine. So these are the main things that we have inside this cardiac protection blend. So this cardiac protection blend that we have already, we know already what it has, improves cardiac function in dogs with mitral heart murmur, but as well help reduce heart enlargement. Okay, as well. So this is something important as well to take in account, that it can as well help once the heart enlargement has happened. So now I want to share with you as well a video with the mechanism of action of this cardiac diet, and this is with the courtesy as well of the Purina Institute.
One out of 10 dogs has heart disease. What if we could slow or even prevent progression of heart disease? Myxomatous mitral valve disease, or MMVD, accounts for 75% of dogs with heart disease. Most of these dogs show no outward signs, but internally, progressive mitral valve degeneration remodels the heart. The American College of Veterinary Internal Medicine classification scheme has identified 4 stages of MMVD. In early stages, dogs appear normal until they progress to stage C, when they experience clinical heart failure. Although progression is variable, about 30% of dogs with MMVD will develop advanced heart disease. In heart failure, treatment aims to delay further disease progression and manage clinical signs for improved quality of life. Long before heart failure occurs, changes are happening within the heart. Healthy heart function requires a continuous energy supply in the form of adenosine triphosphate, or ATP. Thousands of mitochondria in every cardiomyocyte produce ATP, mostly from long-chain fatty acids. Using metabolomic and transcriptomic technologies, Purina scientists found that dogs with MMVD have altered energy metabolism, increased oxidative stress, and inflammation. To address these metabolic changes, they identified specific nutrients that could enhance mitochondrial function and energy production, reduce oxidative stress and inflammation. This led to the development of a cardiac protection blend of nutrients designed to improve heart function in dogs with early MMVD. A 6-month placebo-controlled dietary intervention study feeding a complete and balanced diet with the cardiac protection blend of nutrients demonstrated efficacy in slowing progression of early-stage MMVD in dogs and improving key cardiac measures. Increasing left atrial size is the most reliable cardiac measure of MMVD progression. In control-fed dogs, left atrial size increased an average of 10%. In dogs fed the cardiac protection blend, left atrial size actually decreased by an average of 3%. Mitral regurgitation worsened in 25% of control-fed dogs. However, 30% of dogs fed cardiac protection blend improved with less severe mitral regurgitation. Additionally, metabolomic analysis showed that clinical benefits seen with cardiac protection blend-fed dogs were associated with positive molecular level changes, improved fatty acid utilization, mitochondrial bioenergetics, reduced oxidative stress, and reduced inflammation. Balanced nutrition has always played a role in heart health. Now, studies show that feeding a synergistic blend of cardiac protection nutrients to dogs with early-stage MMVD can slow heart disease progression and help improve heart function.
Great. So here you have a little bit more detail on how MCTs as well can help heart function. So we have as well science, of course, behind cardiac care, and we have listened to one of the studies, right? But we have mainly 3 studies: what we call omics study, the dietary study, and the metabolomics. So the objective, for example, of the omics study was to understand the mechanism of MMVD through analyzing molecular pathways in dogs with MMVD versus healthy, and they saw that in this case, the energy let it disappear. Okay, the energy metabolism, antioxidant function, nitric oxide, and extracellular matrix homeostasis was changed. So let's say that the dogs with MMVD was leading these changes. Okay, then we have the dietary study to assess the efficacy of this cardiac protection blend that we were listening, and this is what they have already commented on the pre-19 video. So then it was demonstrated this efficacy on improving heart function and slowing the progression of the disease in dogs with early stage of MMVD. And then we have the metabolomics one. This one's published in 2020. This was in 2019, and the omics in 2015. And then in this case, the results showed that the metabolomic pathway in cardiac protection blood-fed dogs with preclinical MMVD had positive changes associated with improved energy use, reduced oxidative stress, and reduced inflammation as well. Okay, so we have 3 really potent studies as well here. So, and if we go with the latest one, with Hydrocare, with the supplement, okay, is what we call the next evolution on hydration. So first of all of us know that cats are not drinking, sorry, as well as dogs. So cats concentrate the urine more than dogs or mans. And then cats spontaneously drink less pure water as well. And the minimum water requirement for cats is less, but they have as well a weaker thirst drive. Okay, so all in all, this makes that sometimes cats are not drinking what they should. So in which situations can a cat benefit as well from an increased water intake? So for example, when they have urinary issues, specifically as well related maybe with urolithiasis or with other type of urinary issues, we want to decrease the urinary density, right? So then the water will help a lot. When they have a chronic kidney disease, diabetes, hyperthyroidism, or constipation, all these diseases can maybe need or be in need as well of a higher water intake. So we have Hydrocare, which is the new feline hydration supplement. It's a complementary, okay? It's not a complete imbalance. So it's complementary wet pet food for adult cats, formulated to increase water intake and urine dilution. And we offer it as a third bowl. So we are not pretending, let's say, to remove the wet diet or to remove the tap water. We are pretending to have another bowl with Hydrocare, okay, to increase this water intake. So we have shown to increase total water intake and promote hydration, okay, with Hydrocare, to increase the urine dilution, and for sure they love it. So I can tell you that they love it because it has a very great taste. So just here to say that you have to give 1 pouch every 2 kilos per day. So I'm not going to go in depth with all the feeding instructions, but just that you can give it by this. And then, which is kind of the proposed mechanism of action, let's say, that we have with this Hydrocare. So usually what we are doing is that maybe in this case you have water outside the cell, but it's not capable, let's say, to enter inside the cell because it needs a trigger. So what we are giving is osmolytes inside Hydrocare. So then these osmolytes are able to enter inside the cell. So then we will attract water as well inside the cell. Okay, so then these osmolytes will arrive inside the cell and then to hydrate the cell as well. It's more a cellular hydration, let's say. And these organic osmolytes are amino acids as well from whey protein isolate and as well glycerol that we have added. So the science behind the nutrient-rich water, okay, there are many studies on this field as well, and I'm not going to enter in depth in all of them. I'm just going to go through the main clinical outcomes. So we know that with this nutrient-rich water that finally end up as a product like Hydrocare, it decreased urine-specific gravity and urine osmolality as well. So the urine color was lighter, and it improved as well the daily water consumption. It was increased as well the daily water consumption. So cats drinking nutrient-rich water produce a higher daily urine volume compared to tap water cats. And here we have the numbers are 48% higher. Then the glomerular filtration rate did not differ significantly between the groups. So we are not touching, let's say that it's not having another kind of effects that are explaining this increase in water intake or in urine dilution. And the cat's total body water, lean body mass and fat mass remain stable as well. Okay, so this was a little bit how was the study conducted or done. And this is all what I wanted to mention to you today. So I hope that for you have been interesting or innovations. And of course, if you have any question, here I am. Thanks a lot.
All right, so that was the second presentation. And now we're on to the Q&A session, and I can see Ali is already back at it again with another question, so go for it. You can unmute yourself now.
Thank you so much. It was very amazing and informative. And also I learned so many new things that I didn't know before. I have 2 questions. One of them is very simplistic and the other one might be personal, so you can feel free not to answer that one. So my first question is that, does the Purina Institute offer any course or online programs for people so they can get into the nutritional field, and then, you know, they can carry out for internships and, you know, as a career? Like, that's my first question. The second question, you can also, you know, ignore that question. How many tests and trials did it take to achieve the final product? So what I mean by that, how many animals were they tested? What were the side effects? And how did you manage to prevent the side effects in the final product?
Okay, so well, thanks a lot for both questions. I think, in fact, the first one will be more for Daniel, so I will give me more for him. So what we have, let's say, more from the Purina Proplan brand is a website as well, but maybe still it's not on your country. And inside this website, you can find different educational materials as well. So inside there, you can find webinars or e-learnings or other kind of materials. So then you can as well form yourself, let's say. And then from the Purina Institute side, I'm not sure about what they have specifically, and I will then leave Daniel maybe afterwards if you want to answer this one. And then regarding the studies that we do, so we have to take in account one key point that is that we have an ethical committee. So we have an internal ethical committee, but aside from this, we have as well to pass all the ethical committees that we have, for example, in France, because our study center is, in this case, is in France. So then all the studies that we do with the animals always are not invasive. So it's just giving them kind of the diet or something, and then measure, for example, the digestibility or something like that. Because after all the experience that we have, so we know that the diet that we are giving, it's complete and balanced. So from this, we are sure. So we are not going to happen anything bad to the animal, let's say. The only thing is that, for example, we are testing if the MCTs are doing something else or not, no? For example, in this case. So this is something moreover, no, on top that we add from the diet, but for sure, you can be sure that when we test, always we know that it's complete and balanced. So the animals are absolutely safe. And then, so regarding the steps, it will depend as well on the, so it will depend as well on the type of innovation, let's say, because some of them that maybe will need more steps in order to better understanding, or other less. But we try to be, so to build all the possible, let's say, out of the animals. So then when we go to the animals, it's kind of the final step. So we don't try many diets in the animal. We used to try the final one, or maybe we change something. It's more for the palatability. We find that, I don't know, they are not eating very well, or yes. So it's more as well on these sides usually. So I hope I have answered the second one. And the first one, Daniel, I don't know if you are here still or not.
Yes, I'm here.
Okay. To answer the Purina Institute.
Yes, of course. Well, one of the objectives of Purina Institute is trying to really to share all our expertise in the area of nutrition, and that means that for us it's clear how important it is to translate all the Purina science something relevant, understandable, and for sure, the objective is to share most of the research and the knowledge with the veterinary community, and for that, we created the purinainstitute.com. So I highly recommend you to visit the website. It's a quite complete big site where we are trying to consolidate all the expertise of Purina in the different territories. So it's very well organized, so it's user friendly the time you want to navigate, and we are updating continuously the different territories with webinars, with interviews. You can download different materials. You can share some of the materials of the tools with the pet owners, because some of the objectives is really to educate, to support the veterinary community in your conversations with the pet owner. So I highly recommend you to go to the purinainstitute.com.
So does anyone else have some questions? Because there's still...
I think there was one question previously on the vegan diets from my...
Oh yeah, that was actually before
the
Daniel's presentation, but yeah. Also, recent studies indicate that both dogs and cats can do well on vegan diets, usually with supplements. Do you have any thoughts on that?
Yep. So, do you want Daniel to go, or I can go if not?
You can go. You can go.
Okay. Yeah. So in fact, so regarding the vegan, so I will differentiate here vegan and vegetarian. This is one point, but it's true that for dogs, let's say that we can do a vegan diet is not. Let's say the easiest thing in the world, but it can be done, but you have to give many supplements anyway. And then we need to consider as well these supplements from where they are coming. Because if we, for example, in the case of cats, this is more clear, because in the cases of cats, to do a vegan diet, is very, very difficult. So I would say almost impossible. And as well, you have to put some kind of amino acids, for example, as is taurine, that usually are coming from animals. So at the end, the supplements, if you want to do really a vegan diet, you should see as well the supplements that you are giving. And it's very, very, very difficult to do it. And I would not, let's say, recommend it, especially, let's say, as a nutritionist, to do a vegan diet for a cat, taking into account the higher requirements that they have in protein, etc. It's possible, and maybe it can be possible, but it's very, very, very difficult. For cat, I would say that almost none. Maybe vegetarian, yes, that it's more on egg, for example, or something like this. Vegan, I will not go. And in dogs, you can do it as well, but it's difficult. So you will need many supplements to give to the animal. So I don't know if the animal will like very much this.
Anyone else who are begging to ask a questions to these wonderful people from Purina Institute? Sounds like they have a lot more to share. They just need someone to ask the right question. Okay, it seems like you guys were pretty thorough in your presentations then, I would assume. But thank you very much for being here. And it actually works out wonderfully because it's around the time where the presentation had to end anyway. So that's just perfect. Thank you very much for being here and teaching us about Purina Institute, the Vet Advocacy Group, and about nutrition in general. Definitely an interesting field of study.
It was a tremendous pleasure.
Okay.
Thank you.
Yeah,
Yeah.
Thanks a lot for the invitation. It was a pleasure.
And to all the delegates, see you guys in half an hour for the bylaw hour. So you guys can learn more about the new bylaw amendments and all of that before the General Assembly next week. You'll get a link 10 minutes before time. So goodbye, everyone, and see you in half an hour.
Goodbye. Thank you, Daniel and Jennifer.
Thank you. Thank you.
Thank you.
are currently supranational MOs, so what's going to happen to Ireland? Both, or well, all of them are going to become active MOs as long as they attend a session of the General Assembly within 2 years after this change goes into full effect. So they would have the 70th IVSA Symposium, the 71st IVSA Congress, the 71st IVSA Symposium, and the 72nd IVSA Congress to attend. So there's 4 live events, hopefully live events that they can attend. And then they will be recognized as active in the meantime. And once they've attended, they'll also be recognized as active. If they don't attend, they'll be recognized as inactive. Doesn't mean they're going to be terminated in any way whatsoever. So they're going to go back to being a candidate MO. And then once they've attended another one, they'll actually be an active MO once again. So that is basically what the constitutional amendment is about. I do want to highlight here that a constitutional amendment needs to pass twice. I've said this before, but I'm going to say it again just to make sure everyone's on the same page. This constitutional amendment was already proposed at the 69th Symposium. So that was past February. At that time, it passed with a 98% no, 98, yes. Yes, that's how you say that. 98% majority. And hopefully we can get 100 this time around. So it already passed once. We're reproposing it again because a constitutional amendment needs to pass twice. A bylaw amendment only needs to pass once with a 75% majority. The constitutional amendment needs to pass with a 75% majority then. So yeah, that's what we're going to go for this time round. And that's why we're discussing it again. So everyone who was there last time, sorry you had to hear me explain it again. Maybe you'd already forgotten some of the details. So now, you know, it's just fresh in your mind. Let's see. That's it for me on the constitutional amendment. Does anyone have anything else to add on top of this? Maybe some of the co-authors of this amendment. If you don't have anything to add, maybe one of the delegates has a question on the constitutional amendment. Okay. I do want to add here as well, is that we have started with a buddy system for mostly for next weekend. So all of you delegates are going to be kind of put into little buddy groups and appointed to one single IVSA official who's going to be like your buddy, and they're going to take care of you. They're going to answer all of the questions you have. The buddies have been assigned to the officials yet already. I have seen some groups already being formed. So if you don't have your buddy group yet, just be patient for a little while longer. I still need to make mine. I'm so sorry. Anyways, in those chats, you can also ask questions in between this weekend and next weekend. So if maybe this constitutional amendment is just super new to you and you haven't really had a chance to look at it yet, do look at your little buddy, or do look at the constitutional amendment before the GA, and then ask your buddy if you have any questions, and then I'm sure that they can help you along and answer some of solve some of your doubts and concerns in the meantime already. I saw a question, what is a buddy chat? So that is one official basically taking care, having a little WhatsApp chat with a couple of countries, and then with those delegates, and then those delegates can just answer all of the questions. There are going to be buddy hours before each General Assembly to go over some of the procedures we're going to do as well during the GA to make sure everyone knows what they're supposed to be doing, what they're supposed to go through. Basically, they're just kind of your contact point within the team of IVSA officials. Okay, so with that being said, we're gonna go to the actual IVSA bylaws. I did not actually go through the trouble of putting 42 pages into a PowerPoint. I just didn't feel like it. I'm very sorry. It would have been just too long and completely unnecessary. So I'm gonna go here and I don't know. Yes, you can see them now. All right, so these are the IVSA bylaws. A big shout out to Mehdi for making them look pretty as ever. The table of contents, which is very nice because when you click on something, you're supposed to actually go there. Hi, techie. So this is the table of contents. It just has everything we're going to go through at this point. So this is where it starts. Can everyone read it properly?
Meryl, someone has the hand raised.
Maybe zoom just a bit. Okay, so I saw a hand.
Oh, no, it's not raised anymore.
Okay, then. Do you guys want me to read everything out loud? Daniel's like, no, stop it. Don't you dare think about it. No, that's good because I don't like hearing myself speak that much. This file can definitely be found in the delegates drive. It has also been emailed to you already. Has been emailed to all of the delegates. It has been emailed to all MOs as well. Some time ago, I think about 2 months ago when we finished it, to get some prior feedback at that point. And that is what I am going to do, Lisa. So I'm going to just continue scrolling. I'm going to make sure that you guys have some time to read everything. And then once we're at a point where you have a question, you can go ahead and raise your hand. I hope the silences aren't going to be awkward. Maybe I will just say random things in between. So first up is general regulation, where we have the corporate identity and the official relationships of IVSA.
Your white noise again, Daniel.
There we go.
Yes.
One thing to note regarding these first few paragraphs is that they are virtually unchanged from the previous version because it's the corporate identity and official relationships, just as an FYI.
Thank you, Daniel.
for the code of conduct, the hyperlink in there just links to the version of the code of conduct that is updated at every GA. Just so we don't have to update the bylaws whenever there's an update to the code of conduct, since that can happen outside of the General Assembly.
Do mind that the IVSA website is currently out of service, so we cannot open it right now. Just give us a couple more days to fix it. I'm just gonna go ahead and give unnecessary comments in the meantime, because I am feeling awkward sitting in my room silently. So all of this has been going on about the General Assembly. So we've gone over the General Assembly positions, chair, parliamentarian, secretary, and now we're at the election committee, which are the three people that are going to be in charge of the nominee hour sessions tomorrow. So that's going to be exciting. Let's see. As you can see, there is lots and lots of information in our bylaws, and there is a lot to go over. I don't blame you for not having read them yet, though I do really advise all of you to read this and read the explanatory document that was sent to you, which Anya's also very kindly already put in the chat before the actual General Assembly. Preferably don't do it the day before, because if you have any questions, it would be very nice for your buddy as well if you don't do it 2 minutes before the General Assembly convenes. But you are free to ask questions whenever and at any time you want. Now here's a little thing on the special General Assembly, and that's what we're having now, because live events kill people, and that's very sad. I'm just, honestly, at this point, I'm just talking because I can see Lisa laughing, and even if it's just one person, it's good enough for me. Too. Daniel too. Off to General Assembly procedure. So that's the Robert's Rules of Order, newly revised. Oh God, what a mess. So Robert's Rules of Order are a whole lot more complicated than the ones we use, but they are super, super useful for actually making RGAs. So that's what General Assembly kind of is abbreviated to, making RGAs a lot less chaotic, because there's rules and then people can only speak when they're allowed to speak, and that helps a lot. So all of the Robert's Rules of Order are going to be explained to you, to the voting delegates in the voting delegates prep meeting, and they're also going to be explained once again at the start of the GA by myself, and I'm very excited to explain all of our strict rules to you. However, I'm going to say this 10 times then. I'm also going to say it now already. And that is that though we have lots of strict rules with Robert's Rules of Order, you do not need to be scared to doing something wrong. If you say something wrong, if you don't say it fully correctly, if you don't really stick to the rules because you forgot how it goes, don't be scared. No one's going to kick you out of the GA. So just speak up, and if you do something wrong, our lovely chair is just going to tell you how to do it correctly. And then all will be fine. So please don't be too scared of making mistakes during OGA or making mistakes during this. If you're like, please just don't be afraid to speak up. We're not horrible people. I hope you know that. We're here to help you and help you understand what we've been up to this past year, basically. Now, this is the exciting part because this is super applicable to us next weekend. Virtual meetings. So our meeting room is going to open 30 minutes before the start. We're going to do a fun roll call. If your internet sucks, that's on you. I am once again gently reminding you that if you have a question about anything that is stated here, or somewhere else I'm going to scroll to, you need to raise your hand. Look at us go on page 15 already. Doing so great. Yes. Pure speed indeed. So, election of IVSA officials. Also super exciting, because that's also what we're going to be doing next weekend. I've been working on the nominee presentations today, nominee hour presentations, and I was very excited to see that so many of my old friends and so many of my hopefully new friends are running, and I am very excited to hear all of you answer some very tough questions tomorrow. I can't look at the gift. Let me go ahead. That's me right now, indeed. I just spent an hour chilling in the sun though, because we've had rain for like a week straight, and now there's sunshine. So I'm making sure I'm actually enjoying it as much as I can, whilst also attending all of this. Also, if you are running for something, do make sure to also read the elections part of the bylaws super carefully, because it's always good to know what you're actually partaking in. A fun part on how IVSA spends all of its money. Travel reimbursements. Also, look at that pretty Purina Institute banner. We love them. Doesn't everyone read the IVSA bylaws before bedtime? I mean, that's what you have to do when you're an IVSA member. Start reading and never stop. Once you've finished, you know what you do? Start at the top again. That's how it goes. Until you can recite them by heart. I'm pretty sure Lisa can memorize or has half of them memorized at this point. Even more so than me. I should have prepared a quiz after this to ask you some fun facts about the IVSA bylaws. Too bad. Maybe I'll make a Kahoot afterwards. That would be fun. You can do them in your own time as well. Oh, and then the winners can get a prize. You see what happens when you read the IVSA bylaws? Great ideas come to you. That's what happens, and that's why you should read them more often. I want to help with the Kahoot. Kahoots are my thing. But you do it, and then I'm going to help later on, and it's going to be good fun. So it wasn't a bylaw committee, it was a bylaw task force, which is very similar to a committee, but it is not the same thing. The difference between the two will later on be explained in the bylaws, but I'm going to just go ahead and say it now as well, because it's not like I'm that busy doing anything else. A task force is a temporary group of people within IVSA created solely for the purpose of tackling one specific issue or topic within IVSA. A committee is not temporary at all. It's a very permanent structure within IVSA that also has an actual IVSA official chairing it. Alison, you are funny. Let's see, it has an official chairing it, and it basically just covers a pretty broad topic related to IVSA's mission or veterinary medicine in general, such as animal welfare, One Health, veterinary education, etc., etc. You know them. So yeah, that is the difference between a task force and a committee. How is the task force doing now? Well, I'm doing fine. Daniel is sitting in front of like 4 laptops at the same time, managing all technical stuff. So His eyes might be tired after today, but I'm sure he's fine too. And then there's Elwin, who was chairing our task force. I'm saying was, technically he still is, because if nothing gets approved, who knows? Maybe we'll have to just go on for another year. Oh my God, guys, there's going to be an actual comment. Not yet, though. I mean, unless some of you just want to comment now, that's also fine. But I'm excited. Honestly, Daniel, do I even look like I know what a remote server is? I do. Nah. Good luck fixing our website. We are thankful for your laptop, your desktop, and all of the servers you have. What happened to the website? I believe some old document was doing something strange to it. And that is why they no longer wanted to have it online, which is very sad. All right, treasurer. The only exco position with a 1.5-year term. Managing all the monies. It's not, is it? Well, technically, okay. Oops. Yes, president is also 1.5 years. I just didn't experience it in that way. So that must be it. I can see Brandon just joined. Hello, Brandon. We are going through all of the bylaws, and it is a lot of fun. The executive committee shall have a live meeting at least 4 times during its term. What a joke. We wish. Funniest shit, most depressing shit. Who knows? I can't even tell at this point. I feel like I could give my voice to Google Translate too. I do really love hearing myself talk, so it wouldn't be the worst thing in the world. I also think I would be just a good voiceover in general for like trains and like other public transport. Fun fact in between, I think the Netherlands just got a new person doing all of the voiceovers for trains. It wasn't me. Very disappointing. We did. Yes, we did, Elwin. Please mind the gap. Did I do that well? Is that good? What do you mean it wasn't good? Stop it, Daniel.
It's gonna take some practice.
Okay. Honestly, I really am like the biggest Nicki Minaj fan. I once went to her I was just gonna say Congress because that's like what IVSA has been doing to me. I once went to her concert in Brussels, and it was amazing, and I almost cried. Happy tears. Yes. Yes, for Nicki. I can rap plenty of verses. I'm not gonna do it now, though. Maybe at the end. You know what? One of the GA Energizers is gonna be me teaching you guys a Nicki Minaj verse. That would be so funny. I'll put on some Nicki when, you know, there's like time for you guys to discuss things. And you can like see me actually enjoy myself.
Please let me know when you put on music so I can stop the live stream. Otherwise, Google will ban our account again, and it's not useful.
I'm not going to do it now. I'm going to do it during the GA. But thank you for telling me, Daniel. I definitely will let you know by then. I have actually looked into options of virtual karaoke for IVSA officials team building because I love karaoke with all of my heart. Too bad it's not that easy, and there's often a bit of like a time lag. So then, you know, it just sounds very off and weird. And though I really do enjoy hearing myself talk, I don't really enjoy hearing myself sing, because it's bad. And so yeah, virtual karaoke, not for me. My favorite Nicki verse, by the way, is in Monster by Kanye West. That is a good one. I'm getting such excited reactions right now. Daniel, you're just butthurt over our karaoke incident. But once I make it up.
Okay, so everyone, we're at the trust section, and I think this is very appropriate regarding trust. Meryl Knobs once stood me up in a karaoke duet of Candy Shop, and I was stuck doing both voices alone, and that's why I'm butthurt. I feel so bad and have done for multiple years.
I have actually apologized to him multiple times already. He is yet to actually accept my apologies. So, you know, I've got that going for me, which is very sad. But I am very sure that at the next event, so every one of you needs to be there at the next event. I really am going to make it up to Daniel, and we're going to do the Candy Shop duet together. Yeah, poor Daniel. I am a horrible person, but, you know, it's all in the past. Oh, there's a comment. Lisa, go. Can you unmute yourself? No, I'm gonna let you do that. Oh, yes, you can.
I was gonna share its reason then in the chat, but yes, we should all have a memorial for Daniel's lost duet. But I have an actual comment on the bylaws, finally. And it's on section 9.1, because currently we mention in those bylaws that we have 5 standing committees and 1 working group. But we intend to turn that working group into the alumni network. So if we're going to do that, then we should remove the working group from the bylaws and exchange that with alumni network instead. And then that should be corrected for this entire section. So if that's all right, I can either like bring that as a comment now or make a motion during the GA. Whichever you prefer.
It's going to have to be during the GA.
Then I'm just going
to
you know it's going to come.
But Elwin also has a hand, so I think he's going to want to respond to this.
Can you guys hear me? I'm having a bit of a ghetto microphone situation, so
it's not great, Elwin. It's not.
Oh no. How is it now? Okay. Lisa, just text. Okay, I'll do it later.
That was horrible. Anywho, Lisa, I think what Elwin meant to say was just text him, and then you guys can figure it out together. We did already also discuss this in our little bylaw task force chat, and we do agree with you. So. And here it is. Standing committees are permanent, task forces are temporary. As I said before, I hope you all still remember with all of the completely unnecessary stuff I have been saying in between. We're at page 28 already. 15 more to go. Good job taking notes, Allison. I wouldn't have expected anything less from you. Oh God, that is bad. Oh God, what a day. Anyways, while I continue scrolling, I really hope everyone enjoyed their first day of our little educational weekend. I know I did. I attended the radiology lecture and the farm vision one, both at the same time, because that's what I do, multitask. And then I was also there for the Purina talks, and all three actually went very well. I was super happy with them. I really hope our speakers were also happy. And I hope that you guys enjoyed a lot of it too. Oh, I love donkeys. I wish I was there, but I wasn't. I don't think anyone has the powers to one-up me Okay, so now only one person said the first day was great, and I want to hear more people say it was great. So please, like, just put it in, put it in the chat, so I can feel happy and proud of the amazing online organizing committee and the OAC. Thank you. It was very great. That's what I like to hear, guys. Oh my God. Oh my God. Oh. And we're back. I am very pleased to hear that so many of you had such a great time. That's good. So yes, OOC, I hope you're seeing all of these comments. And I hope you feel happy and proud of yourselves, because you should, you deserve it, because you did an absolutely amazing job. And I am confident that tomorrow is going to go just as well, and all of us are going to have just as much fun as we did today. The nominee hour isn't going to actually contain as much speaking by me, though, so that might be, you know, a bit less fun, but you can always text me and then I'll just try and say something funny. Who knows? Maybe it might make you laugh. The dates for the next assembly, do you mean like, so I'm assuming you don't mean next weekend. I hope not, because you should know. But the Mexico event, so that's going to be the symposium, is known. I can look it up for you. I wish I knew it by heart, but I don't. Ooh. There aren't any dates on anything. How am I supposed to know when this is taking place? Oh, thank you, Lisa. 17th to 27th of January. So that's going to be in Mexico. Okay, you can have some tacos. I'm going to have a shit ton of tequila, and I'm looking forward to it, and it's going to be so much fun. So the 70th IVSA Symposium is going to be in January in Mexico, and then there's going to be another Congress in July, and that's going to be in exactly 1 year from now in Sao Paulo, Brazil. So we're going to have lots of events in Central South America coming up. And that should be fun. I'm sorry, Daniel. I will stop swearing. It's gonna be hard, but I can try. Let's see. So is it going to be in person? We can't really tell right now. We really hope it will be, and we're preparing for it to be online. Mexico does not really have that many restrictions, but it's mainly going to be an issue for people leaving Mexico, going back to their countries, and then possibly having to quarantine. For me, the event is in the middle of my exams. So I hope I'm going to be able to make it there, but I should. Aw, Gabriel, you guys are doing an absolutely amazing job, and I'm super, super excited for Brazil. Have so much faith in you, and it is, without a doubt, going to be an amazing event. I do hope it's not going to be the first live event we're going to have, because I really do want Mexico to happen, but then Brazil is going to be just as fun. The visa is not included in the fee. No, that is for your own costs. Lisa, you have a hand. I'm gonna allow you to. Someone's always first. I don't know who.
I had a hand for, if you scroll like 2 centimeters down, namely 12.3.7. It says, yeah, the Congress or symposium fee must be payable electronically. Just speaking from experience, in the past, we've had some MOs that under no circumstances could transfer the fees. I know specifically that is the case for IVSA Algeria. This has been discussed within the OC manual task force as well, because this is an issue that happens from time to time. I completely agree with that. We want it to be electronically no matter what, because that is ideal, but we should keep in mind that sometimes situations do come up due to which people literally cannot transfer the money. So I was wondering if maybe someone from the Bylaw task force has some comment on that. Wait, not too much static, perhaps? Daniel?
All right, I can comment on that. As a previous treasurer of IVSA and the person who helped write this, I will say it must be payable electronically. It doesn't say you have to pay electronically. You can also pay in cash, but you need to have the option to pay it electronically in advance so that the OC have money to spend in their own country and not until after people arrive. Myrtle, it's you.
Yes, I know. Stop being so impatient. My fingers are starting to hurt from all of the scrolling I'm doing. Is IVSA gonna pay for my medical bill? I think not. Acceptance to events is not guaranteed. No. You can apply. Applications are supposed to open for a symposium at least 3 months in advance. And then usually delegate selection would happen pretty soon after. So that's about the time frame you have for booking flights. I would advise against already booking a flight before you've been accepted as a delegate, just to make sure. I mean, you can still fly there, then you just won't be a delegate. So it might not be as fun. Is someone from Mexico here? I've seen people from Brazil. I'm not sure if any of the Mexican OC are actually present here to answer, but 3 months in advance usually, yes. Lisa?
Yeah, I had another comment regarding point 12 Congress Symposium, but I don't see it specifically as a point because it was on the list of changes that was sent out. And that was, I copy what it said. In the current bylaws, it is stated that EOs and presidents have the priority to be accepted to Congress and Symposium. This statement has been removed to give more flexibility to the OC and MOD team to select the best delegates for the event. So maybe someone from the Bylaw task force wants to comment on that first, but I would like to say first, to get started, that we had a discussion with this within my MO, because we have considered that like being a priority spot as a president or EO is for us a big pro for people actually coming into the MO and deciding to become an EO or a president, because they then get the priority to a Congress or Symposium. And I think that is the case in other MOs as well. So that is a point that I think should not just be removed like that. That's at least something we should discuss. But I'd like to know what the thought behind it was from the Bylaw task force.
So I think explanation also already mentioned is that the thought behind it was just to give more flexibility to the OC and the MOD when it comes to selecting the delegates, as to not interfere too much with the decision-making process, especially when you're looking at countries that have like I think Egypt has about 10 or 11 MOs. And then if all of their presidents and EOs apply, that's going to be, it's going to kind of force you to have to take on lots of.
Yeah, because maybe then regarding if we accept the new constitutional amendment, it would be better to change that into national MOs, so that at least there is still some motivation for national presidents and EOs to get involved, because I have heard from other MOs before that that is what they use to promote people getting involved on that level. So maybe that's worthwhile, but I'm curious to hear what other people think about this as well. So maybe people want to comment right now.
I'm going to give Laura the floor, and then Anya can go. And all of you can speak.
Hello. So Laura from France here. I'd just like to say, I think perhaps giving priority to presidents and EOs of national would be okay, but I do agree that we shouldn't necessarily keep as it was before, that all presidents and EOs have a priority, because of the flexibility thing that we've talked about before, but as well because I think it shouldn't be the reason that people are going to sign up to be president or EO. I've heard a lot of things, and I've seen firsthand in my MO people be presidents or EOs simply because of the title and because of the priority that title gave them for other positions, or for just writing it on their CV. And then they weren't at all the most active people in the MO, and they weren't the people that deserved to go to the congresses or to the symposia the most. And if they did go, they weren't always the most involved. And I'm talking from my MO, but also other MOs that I've discussed with. I don't think that it's fair to give presidents and EOs priority by default, because then the people sort of just take it for granted that they're going to be taken on at the Congress or the symposia, and it shouldn't be an argument for them to take that position, because that position comes with responsibilities. And if they're not up to those responsibilities, then, and if they're not motivated by IVSA as a whole, then they just shouldn't be in that position. So I agree with removing it. I would be happy with the compromise of saying we keep it just for national EOs and presidents, if everyone thinks that that is a good idea. But also, I'm also happy to say that there is no priority, and it comes down to the motivational letter, and believing that most of the people who took on positions as presidents and EOs are actually going to be able to write a motivational letter that is convincing enough that the EOC will take them.
Okay, then Anya and then Daniel.
Thank you guys for the question. So also another reason why we decided to remove it from bylaws is to make our bylaws more clear and coherent, and also less binding. We decided that it would be better to keep this recommendation to accept EOs and presidents, especially of the national MOs, in the OC manual that is also being created parallel with the new bylaws, because we believe this is a better place for this recommendation, and then it's also not this binding. So in case there is this kind of situation where there is an EO or president who should not be accepted, well, we have more flexibility in there.
Thank you, Daniel, and then Ali.
All right, just for all you new people, the OC manual is something we recreated from scratch based on the experience of the past, I don't know, 3 or 4 different OC teams of actual events, not the online events, along with some experiences from the online organizing committees. And yes, in there it states exactly what Anya said, that EOs and presidents should be preferred in order to know when you actually select the delegates. And that way it's not forgotten, but it's not written in the bylaws, because most changes in the bylaws should be there relatively permanently and not be subject for change every other year, or when we, for example, get rid of local MOs and change to national MOs. This will alleviate most of those problems.
Thank you, Daniel. Okay, then Ali, you can unmute yourself.
Thank you so much. So I wanted to say that Laurel has a very good, I'm sorry if I'm mispronouncing that, by the way. She has a very good point. Sometimes that usually also happened in my, IVSA member committee. A few years ago, I'm not going to mention any names or anything. So that cheating of a system happened. Like some of them were, qualified and the members were not. And I always get this question a lot. Like, are members even, get a chance or application to, engage in this symposiums on Congress? And also, one more thing, is English a necessity for the Congress to be accepted in? Because most of the students here, I'm not saying that they don't know English, but like they're not very well, I don't know, advanced in it. They would understand, but they would find communication and, speaking a bit hard. So that's all.
Okay, thank you. You make a very good point. Unfortunately, IVSA at this point does not have the funds to have translations present in lots of different languages, not live translations as we speak. But it definitely is something as well, that just translating all of our bylaws into different languages is something we can consider in the future. Though it is still a challenge for us. So if you have some trouble speaking English, feel free to reach out to your buddies, take your time at home to maybe even just like put the bylaws into Google Translate, and just try and maybe read it in your own language, so you can see what exactly it means. If there's specific things that you have some difficulties with, and then you can always ask your buddies in the meantime as well. So if you feel like maybe this is going above your head right now, or if you don't feel as prepared for commenting on these bylaws at this point, I would highly advise you to read them in your own time. Read them before bedtime, as Lisa said, is a great thing to do. It might actually make you quite sleepy. So do that, and then hopefully that's going to be a bit easier to understand as well. Okay, then I am going to continue with this. Look at me scrolling, making puns all at the same time. So we do a financial report at every single event. So at our symposium, we approve the previous term's financial budget. And then at the Congress, we have a preliminary budget that we present. And that's going to happen again this time around. You can find the preliminary financial report for this upcoming SGA under General Assembly documents, probably officials, updates, and then the treasurer one, Panos, has made the report. So it is in there. We do them for every event. And we made it through. This is a little annex and the membership fee factors, the size factors. And that's it. That was it for the bylaws. Okay. That went a whole lot quicker than I expected. I actually expected there to be like a lot of people with questions and stuff. Okay. So kitties again. So I do want to ask if anyone has a question at this point about the bylaws, bylaw amendments in general. Yeah, we did such a great job. So if you have any questions about these bylaws, the previous bylaws, or well, basically the current bylaws, and then hopefully these are going to be the next bylaws, or anything else, please raise your hand. Because I would love to hear them. Let's see. So I'm gonna, Daniel.
So I know it's a lot to take in now, especially if you haven't read them ahead of time, but please do take the time to, at the very least, look at the list of changes and differences introduced in the revised bylaws. That's only 8 pages and they're not very tightly written, so you guys can easily go through that. And then after reading that, you can look through some of the sections in the bylaws on your own time and please have some comments. It makes no sense that there's no comments. We usually discuss for an hour where the comma should be, and now we've had 42 pages, and not one person has told me I put a comma in the wrong place, or I used American English and not British English. For the record, British English is what we're using in IVSA, just be aware of that. So don't comment that, but please look through them.
Yes, do that. But also, I don't want to talk about a comma for an hour. So let's just all together decide we're not going to do that. But I do want to hear all of your actually meaningful comments. So yeah, then I think that is it. As Daniel said, read up on the explanatory document. That's going to be a whole lot easier for you guys to just read through, a whole lot quicker than the 42 pages, and then just go through whatever you find interesting. And then hopefully we're going to have a discussion, a bit of a discussion during the GA. We're not going to approve them all at once because that's going to be too much of a mess. We're going to do them section by section. So per chapter, we're going to do it. So in 14 different amendments instead of just one, to make it a bit easier for all of us to actually go through it. And then, well, a big round of applause for the Task Force on Bylaw Realignment, because they've done an incredible job. So yeah, thank you guys. You have been amazing. And I'm super, super proud with the final result. And I'm very happy that we actually got to this point with a whole new set of bylaws. And I'm super excited for us to actually start moving them during the General Assembly. It's going to be nice to say that we're going to strike out everything and just replace it with a whole new thing. So yeah, thank you guys. Also, thank you to you as a delegate for being here and for bearing with me through my, maybe you thought it was boring, maybe you thought it was fun, chit chat. And I hope I get to do it more often. And I hope I get to do it once again soon in the future. We have actually timed this pretty well, 5 more minutes. So thank you so much for being here. And I can't wait to see you again tomorrow when we're going to start up with our partner talks, which is also going to be a whole lot of fun. So yeah, I will see you all soon. Thanks for being here. Love you all. Bye. Now go ahead and go to sleep, Asia, and enjoy the rest of your day for the Americas.